Megan Fox has the story.
Megan Fox.
Megan Fox.
Megan Fox.
Megan Fox. Megan Fox, a national journalist.
Mastodon. I will never be able to say that.
It feels like the Flintstones live there.
It does.
Well, don't trust women. I think you just touched on that with your last. That's what they brought. We're going to have to bring back chaperones.
Jesus, no.
Just careful, Carol. Stop! Break! Ooh. Hard right.
How did you screw up a stove, Megan? You're a woman. I thought that was baked into you, like at the genetic level, how to operate kitchen equipment.
And honestly, Megan, if you don't like it, I'm sorry. I've been very nice to you.
Look at Dino hanging out outside chewing on a large bone. I highly recommend being targeted by the New York Times and Rolling Stone for weight loss. And I'd say, keep it coming. I need to lose 20 more. Please, keep it coming.
Explain to me, Megan, why did this country not have a holiday once a year? That's the time you vote. If you don't show up and vote, up your ass. You don't get another chance. You don't get, I don't care if you're in the hospital. Crawl to the stake, crawl there. But that's it, 1 day, 12 hours, and then you're done. And you count them that day, and that night you know who the hell won.
I will eat you alive. You want to tangle? You want to go?
The only thing going through my head is, what are you going to do when Megan Fox runs wild on you, brother?
He made a deal with the devil. She's the devil.
He wants that.
Oh, God. Gross! Oh! All right. Penalty box for slug. Yep.
Of a mile.
Are you ready to behave yourself now, slug?
This frustrating rep.
Are you ready to behave yourself? Repossessed puppies? I'm hiding pork chop. ASAP. Have you seen his little pork chop? Oh my God, pork chop is the cutest.
That sounds bad.
Have you seen it?
Pork. It's pork.
Though you may be tempted, do not contact any person or persons mentioned on this stream. Do not even think about contacting anyone who may be the topic of the daily news. If you should do that, the host will question your IQ, possibly call you names, and mock you for disobeying these basic rules of decency.
All the best.
Good morning, everyone. What the hell is that? What happened to my screen? Good morning. Welcome back.
Morning.
I don't know what that was. That was so odd. Oh, here, that's what I was trying to do. Good morning. Good morning, everyone. Welcome back to the stream. It is cold in New York. It is like 50 degrees. I'm happy to say that it is velour track season weather. And I will be wearing my velour tracksuits from here on out. I have them in all different colors, and this is it. Sundress season is out. Velour track season is in. Yeah,
Okay,
that's it.
but is it juicy couture or pink on the butt thing? Because if we're
No,
gonna match,
neither one. I do completely solids. I find that like the grandma variety, like grandma used to wear, it has to have pockets for your tissues. You got to have pockets for
Okay,
the
but
tissues.
where are the rhinestones that you applique and the puff paint around it?
No, none of that. I have one in turquoise. I have one in black. And I mean, they're the comfiest things ever. Look, matching pants. I mean, it's just the greatest. It's the greatest. They're the greatest clothes ever. I'm sorry.
Granimals for grandmas.
Yes.
Hey.
Great.
If Garanimals would create an adult series with like Kersey t-shirts, I love you, LuLaRoe. Could we stop with the florals though? I don't want to look like a 4-year-old. You've got stripes and florals in the same thing. I look like I'm schizophrenic when I'm trying to wear one of those outfits.
I'm way too tall for that stuff. I look like a giant whatever it is. Like
I
if it's
look
got
like-
a big floral pattern on it, I look like I'm wearing a tablecloth.
Yeah,
Headphones are stuck. I'm stuck on my chair. I can't get the headphones. The wire is stuck. Okay.
Oh,
I'm
no.
out. I'm out. I was stuck there for a hot minute. I have them in the wrong ears. Like, it's a whole mess right now. I don't know what's going on, but I tried to. Never mind. It doesn't matter. Today is day 19 of the Timms trial. We are watching.
Have we been doing this 19 days?
We have, yes.
Wow.
It feels like we've only been doing it 5 days.
Right?
It's been
I have only been doing it 5 days.
Yeah, Rosalind has been less than on time and consistent, but that's okay. That's okay. We can get along. We're getting along anyway. I'm still tangled. God damn! I can't get my hair is tangled in the wires. Ah.
That's why you gotta go with the wireless ones, you know? I have no strings to hold me down, to make me smile, to make me frown.
We're real kids now.
Right? I got no strings and now I'm free.
You keep saying this, but do you know how technically challenged I am? Imagine last night's show.
Megan,
such
if
a
I
shit
can
show.
work a wireless earbud and I need help, a priest, a Unitarian, and a Catholic to turn on my computer.
Nobody needs a Unitarian for anything. Like, who are you kidding?
Look, I'm covering all my basics. I have Catholic, I have Methodist, so Catholic light, and then I've got Unitarian in case God's in a not Catholic mood.
Nobody needs that. Nobody needs a Unitarian. They're good. What are they good for exactly? Absolutely nothing. All right, I'm just kidding.
Hey, really fun Christmas decorations with all the holidays.
If anyone is a Unitarian in the chat, I deeply apologize. I will pay my fine. Tim's Defense Bingo. We have updated it. Why are my spaces empty? That is so bizarre. Okay, anyway, don't worry. It's fine. We have Tit Talk, Nothing Burger, Boom Roasted, State Badgers Witness, Reading Glasses, Mic Drop Witness, Mic Drop Judge, Thug Judge, Witness Makes State Look Stupid, Damn, Irrefutable Proof, Free Space, Brassy Locks, Hunty Behavior, Hair Talk, Objection, Hearsay, Sustained, Overruled, What do you do here? Witch Sighting, What a Bitch, Making Shit Up, Flux is Gonna Get Angry, The C Word, Get Squunched, River Dancing, Spider-Man Meme, Do You Have a Question? Angry Swede, Chat Breaks Panel, Megan's blood pressure is over the roof. Sidebar, Questionable Certification, State Repeats Objection, Cork on the Fork. I think that's my favorite square is Cork on the Fork. We can thank
That's my favorite.
We can thank Nicholas Starro for that one.
Angry Swede.
Angry Swede.
Good morning, Nick.
Don't worry about the blanks, folks. The blanks will fill themselves in when you hit generate. It's a thing that it does in the edit function. Just ignore the blanks. Circle Squunch, Chat Contempt. He sees you when you've been bad. Rude. Judge Werther's break. Shut up. Simulation does not disappoint. Chat hates prosecutor. Panel hates prosecutor. Unknown significance. Everyone gets angry. 15 minutes of obligatory bullshit. Squirrel. USA. Dumb and proud. Panel cheats. Fake words. Muted boomer. And bitch slap. All right. We are there. We have done it. Let me save this. Okay. Save. All right, now if we generate, this is how you do it. You click the link that I pinned at the top of the chat, and then you generate a card. And see, look, I told you it would fill in all the squares. So here's my bingo card for today. Oh, good, I have Cork on the Fork. That's my favorite one.
I have to download another, or I have to generate another one because I don't have it.
Cork on the Fork is the
cheating.
best one.
There
And
you
for
go.
sure, we're going to hit Cork on the Fork for sure. There are too many stupid people in this trial to not hit Cork on the Fork. Don't forget to hit the like button and subscribe, and make sure that you visit Super Tips, because Super Tips are fun. And Super Tips will share fun AI voices. You can send, it's like a super chat, but it does AI voices instead. So you can go there and check that out. And it is also pinned to the top of the chat. All right. I am going to... Yes.
We're in a cult. Did you hear?
Oh, I did. I heard. I'm actually quite annoyed that I did not get called a cult leader. I feel like I have all the qualifications, and David Jenkins did not call me a cult leader, and I feel a little left out.
I mean, Lauren with her short hair, I mean, kind of cultish.
You know what I think? I think that I need to go make some videos about that. Probably. So I'm going to try and pre-record some videos for tomorrow, since I won't be here because I've got doctor's appointments tomorrow for one of the kids. So I'm going to be out in the morning, and we won't have time to do a trial stream. But I'm going to pre-record some Laura Owens update videos to release tomorrow. That should be a lot of fun.
But I am in so many cults, I can't keep track anymore. Like, of all the times I keep getting accused of being in cults, and I'm like, damn, I'm either a really bad cult member because I just keep hopping cults, or just these people don't know what the fuck they're talking about. But I'll choose the cults. I'll be in a billion different cults.
Can you be a cult leader if you don't want to steal our money and sleep with our wives? Because I feel like those are two prerequisites.
Ooh,
I mean, because I always said I'd be the greatest cult leader because I may take your money, but I'm not going to sleep with your wife.
Oh, yeah, for sure. I also think that there are many cults out there that I would have liked to join, except for all the weird bed hopping. Why does that always have to be a part of it? Like, did you ever watch Wild Country, Osho's cult? I would have joined that cult if there wasn't all the weird wife swapping. That was a fun cult.
It's a control thing. It's a control and manipulation tactic.
Well, it's weird, and I
mean, it's a cult.
Yeah, I mean, it is a cult. That's true. That's also true.
I mean,
all right.
It seemed like an okay place until they told me to get a purple tracksuit.
Good morning. How are you, doctor?
If there's a tracksuit involved,
and I didn't get cork on the fork once.
Oh my God! Well, keep trying. I'm telling you, if there was a tracksuit involved, though, that's my weak spot. That's my weak spot.
Yep, tracksuits.
Megan's gonna come back. The cult of velour is good. Velour is soft.
Velour is comfy.
Velour is comfy.
It has pockets.
It does.
Every woman would join a cult if it was like tracksuit with pockets, free candles.
Right? Mm-hmm. Yes. Okay. Everybody's asking, how is the dog? Well, we have a video from him.
That was my skull. I'm so wasted. That was my skull. I'm so wasted.
Oh my God, he was so high yesterday. Look how cute he is. Look how cute. He was so high yesterday, though. Like, I went to go pick him up, and he could barely stand up.
Oh, no.
But he was so happy to see me, and he was trying so hard, like, to stand up and, like, be normal. And then he ran directly into a wall. Like, he just...
Oh, no.
That reminds me, slightly about Friday Law Show tomorrow.
Oh, yes. You have your Friday Law Show. Look, he's sleeping, sitting up, leaning on the door of the van.
Oh, it's like after Rin Tin Tin went on a bender. Like, damn it, Timmy, how many times have I told you to get out of the well?
He did really good.
Lassie, what are you saying? What are you saying? Weed.
He did really good, but he also was so high. Look at his high face, you guys. The high face. Look at his not this one. Hold on. That was the fat shaming. He is 131 pounds. Like, ridiculous. Big dog on a little scale. Big dog on a little scale. Look at his high face. One eye is open.
He has Jim Brewer eyes. I've never seen that on a dog.
He's like, man, where's the Doritos?
Where's my chow, bro?
You know what? If he started a cult as the high dog, I would totally follow it.
I know, right?
Same.
So Archie Ruckus is good, chat. Please don't be concerned. He made it out just fine. He's much better this morning. We did find out, though, that we have been quadruple feeding him because he's so good at the begging that he convinces he convinces my children that I'm starving him, and then they feed him, and he does it to them one at a time. He doesn't do it to them when they're in the room at the same time. No. He does it to them one at a time. He is being fed 4 or 5 times a day. And that's why he has gained 15 pounds over the last year, because he has figured out how to manipulate people. So now I have a chart.
He's trained you guys.
Yep. Now I have a chart in the dog room that says Thursday, breakfast with a little box, mom fed, check it off, dinner with a little box. Like he's not getting away with it anymore because he is huge, 131 pounds. Dude, your fat shaming begins now. Like this is bad.
Face. Megan's making him do squats on the break too. She's just paying him Nick's speech. Making him run on the little puppy
over and over again. Yes.
On the little puppy treadmill, you're just making him run.
Aww.
So Nick, tell us about your Friday stream tomorrow. Is tomorrow? Right?
It may or may not be cult inspired. Now, when I know I'm in a cult, and so we're going to read Ginger Ass's when he calls us a cult, and we are going to have so much fun.
It sounds fun.
He is so unhinged.
What time are you starting? What time does that start? I might want to join you for that.
I thought I would start around 4 p.m. Eastern.
4? All right. Well, send me a link. If I can make it, I might show up for some of that because that sounds fun.
Yeah, I'm going to invite all of you people. And
You people.
Just questioning. Which cult do I belong to? I feel like I should have gotten a registration or had to sacrifice a chicken before I got into it.
Are there
which cult are we talking about? Because
this would be the JFC cult.
Oh yes,
Justice
that's right.
for Clayton. The Justice for Clayton.
The Pond Scum Posse.
Yes, Ginger with a soul says, I get a little offended when Nick says ginger ass. Not gonna lie.
No, it's my accent. Sorry, it's my accent. I'm having a hard time pronouncing David as Ginger Ass's name. Sorry.
That's okay. That's all right.
That's
all right. We forgive you.
Do we at least have a cool name for we can't just be the JFC cultist. That's kind of lame. We gotta be
let's figure that out with Nick on the chat tomorrow.
We would have the chat going. We can have a vote.
We can have a poll.
In crapulent conception. Because she had a sort of oral conception. I mean,
God.
The Church of the Holy Oral Conception. I feel like.
All right,
Church of the Disappearing Twins.
You may now check off both Squirrel and 15 minutes of obligatory bullshit because we are on minute. Obligatory bullshit. Do I have either of those? Let me see.
Oh, I had both. Yay! I have a big both.
I don't have either.
Not USA dumb and proud.
Anything on my 3 cards that I have left.
Yeah. I have Angry Swede on mine, so there might be cheating.
Whoops! What happened? Why do I keep hitting the wrong button? All right, here we go. This is Dr. Vidya Krishnamurthy, and she is a pediatric geneticist. So this should be interesting. This is the defense's witness.
Wait, just because I missed yesterday. So she's not a radiologist.
We didn't do yesterday.
Faking? Oh, okay.
We didn't do yesterday.
That's why you missed.
I was at the mall in Goodwill with 2 unstoppable teen shoppers.
That sounds exhausting.
Ooh.
Oh, yeah, Megan hits the wrong button. If you have Megan hits the wrong button, you may now check that off as well. Because I think I've already done it twice today. Oh, God. If anybody witnessed last night's stream, what a shit show. My internet went down. It
was awesome.
At the beginning of the show. Then I had to dial in with my phone, and no one could understand me, but Tug made me stay there the whole night. It was pretty funny. All right, here we go.
Would you please tell the ladies and gentlemen of the jury your name?
Oh, we need the
Vidya
closed caption.
Krishnamurthy.
Okay.
Okay, time out just a moment. pull that microphone down right there and slide your chair up, if you don't mind, as close as you can get to it.
I love her.
She's so good. The way she comes over the bench.
Look at she's climbing over the bench to be like, oh, honey, now you need to put your face right in that microphone because we cannot hear you. Look at her and just scooch up as close as you can. Look at her. I've never seen a judge come over the bench like that. She is not having it. She's not having any audio problems in this trial. God, give her a medal.
Can we clone her? Can we clone her? I mean, because every other court is like, oh, you recorded this on a Casio Speak and Spell from the 1980s? Wonderful, wonderful.
It's so horrible. And look at her. She's amazing.
As you get close to the microphone.
Vidya Krishnamurthy.
Okay. And
Oh, so good.
how are you employed, ma'am?
So good.
Self-employed.
Okay. In what profession? What do you do?
I'm a pediatrician.
What
and
do you do here? Go ahead and check it off.
Geneticist.
Okay. And I want to go through your background just for the benefit of the folks on the jury. You have graduated from college, is that correct?
Yes, sir.
And where did you graduate from college?
Medical college from India.
Okay. And did you practice medicine in India?
No.
Did you practice medicine in another country?
Yes, from Malaysia.
Malaysia. Okay. And how long did you practice medicine in Malaysia?
12 years.
Okay. And while you were practicing, in what field? Was it pediatrics?
First, in Malaysia, we work for the Ministry of Health for 3 years. We have to. Then they allow us to specialize. Then I specialized in pediatrics.
Whoa, Carrie. This poor witness has been threatened by someone and she will not testify like this any longer. They have terrified her to testify for families like ours.
Wow.
But
Seriously?
that does not surprise me in any way. I told you what they did to Dr. Joe Corcoran. These doctors who want to speak up and tell the truth get completely blacklisted. They have their retirements held over their heads. They'll be told you'll never work in this field again. It's the machine against the individual, and the individual has very little power up against the medical machine.
Mm-hmm.
Carrie says you will see how differently she testifies in the Hernandez trial.
Oh.
So you mean between this trial and that one, you think somebody did something? Because, wow, that'll be interesting to watch.
And worked as a pediatrician.
Okay. And were you board certified while you were practicing in Malaysia?
Yes, from UK.
Okay, from the United Kingdom.
Yes.
Okay. And obviously now you're in the United States. How long have you been in the United States?
Since 1999.
Okay. And have you practiced medicine in the United States since 1999?
No, in 1999 when I came, I had to do my board exams and then undergo training again here.
Okay. And when did you sit for board exams here in the United States?
1999, I came here, around 2003, 2002, 2003.
Okay.
Pediatric boards.
Okay. And I presume that you passed those boards?
Yes.
And have you practiced as a pediatrician in the United States since then?
2003 to 2005, I did genetics at Duke University. Then after that, I started practicing.
Okay. All right. When you say that you did genetics at Duke University.
As a resident.
Okay. And how long were you there?
2 years.
Okay. And after that, what have you done?
After that, I was in private practice with Sugarloaf Pediatrics in Lawrenceville for a year. And then because I wanted to continue my genetics career, I had to become self-employed because it takes too much time to see a genetics patient and the pediatric practice couldn't accommodate me.
Okay. And where is your office or your practice currently located?
Alpharetta, Georgia.
Okay. And are you licensed to practice medicine in the state of Georgia?
Yes.
All right. In terms of becoming a geneticist, what sort of specific training have you undergone in that field?
Well, for 2 years, first you do either a family practice or some other residency. In my case, it was pediatrics. Then the 2 years that we are there, we do both inpatient and outpatient. Once a week, we see patients in the outpatient clinic. I assist the geneticist and the genetic counselors. I would go in and take the history first, do the examination, then come back to the back room and discuss with my attending as to what I think the case is. Then she would direct us further to do further testing. Then after that, in the afternoons, I would go into the hospital and do the ward rounds, and I would go and look at consults. Like they would send us to various different floors to say patients who have to be seen. And then I would go see the patients, write the consult, come back and discuss with my boss again.
Okay. And was that at Duke?
Yes.
Okay, and that was for 2 years?
Yes.
All right. And what is the name of your practice?
Pediatrics and genetics.
Judge, at this time, I would tender Dr. Krishnamurthy as an expert in both pediatrics and in genetics.
Ms. Bernard, any objection?
No, Your Honor.
Ms. Fox?
No.
Oh,
She'll be admitted for that purpose.
no objection.
Dr. Krishnamurthy, you have a patient by the name
Right?
of
I'm
Jameson
surprised you.
Timms.
I don't want to vote dear.
And do you recall when you first encountered Jameson Timms?
Yes, it was in February of 2022. 2022 when he was about 4 months of age.
Okay. And what were the circumstances, to your knowledge, of Jameson coming into your
There were
office?
concerns for a skeletal tissue problem. There were concerns for child abuse.
Okay. And on your first encounter with Jameson, what happened during that visit?
I took family history. I examined the patient. Then I looked at the previous test results. Then I ordered further testing.
Okay. And in terms of genetics, was there anything out of the ordinary in terms of what you had been provided in Jameson's record?
From the previous history, he had history of rib fractures. He had history of compression fracture of the spine. There were some bruises that was noted at a previous hospital that raised concerns for non-accidental injury. And then when I examined him clinically, he had light blue sclera, he had soft doughy skin.
Did you receive, had there been any genetic testing done at that point in February when he came?
It was a previous genetic test result.
Okay. Was there anything out of the ordinary in terms of that result?
There were 2 mutations they found, one in the COL1A2 gene, the other one was SP7. The SP7, they said it's likely tolerated. The COL1A2 gene, they were uncertain with it was a variant of uncertain significance. So the lab couldn't tell
Uncertain
us
significance,
yes or no,
check it out.
whether it's going to cause a problem.
So when a patient comes into your office, such as Jameson, do you do any type of physical, any physical examination of the child? And did you do that when he came into your office, that first visit? And what, if anything, did you notice?
I noticed he had light blue sclera and soft doughy skin. And I don't know if I'm allowed to, I can look at the chart to see what else I found in him.
Well, let me stop you there. Do those, and we'll get to why a little bit later, but just right off, do those raise any concerns or red flags?
Given with the past history of the previous genetic testing, there are concerns for connective tissue disorder.
Okay. And what is a connective tissue disorder?
The connective tissue, I like to describe it to my patients as like the Lego building block of your skin, your joints, your eyes, the walls of your blood vessels, and your skeleton. And it's like
Didn't have Legos on my bingo card.
Building, it has to be strong. And if it is not strong, there's a spelling mistake. So the scaffolding is not so strong, you can have problems with the skin, joints, eyes, blood vessels.
After February of 2022, do you know when the next time is that you saw Jameson?
May.
Okay, May of 2022?
I would have to look at
You
the
can look,
chart.
that's fine.
Can I look?
Yeah, you can.
She does have a nice voice. She should be on Speechify so that you can choose her voice to read you
2024.
books.
5/29/2024.
And was that, again, at your office in Alpharetta?
Yes.
How did Jameson, if you know, how did he arrive to the visit?
He came with his family.
Do you recall who in his family was with him?
Grandparents, parents.
And what do your records indicate? Did you do a physical examination of Jameson?
Yes.
On that May visit?
Yes.
What do your records indicate were issues?
Am I allowed to look?
You can't read from it, but you can look at it if you need to look at it to refresh your
Blue
recollection.
Blue sclera.
Why can't she read when everybody in the States case read from their...
Yeah, I'm wondering if they got really onto her at another case, and that's why she's so nervous, because...
It makes me think, like, no, every state witness is just used to getting away with this, whereas, you know, defense witnesses are more careful, like, what am I allowed to say and what am I not?
Was at that visit?
This is like a 500-page medical record.
I'd say about 2 years plus.
And was there any workup or anything done as a result of that visit in May of 2024?
We reanalyzed the test results at GeneDx.
Okay, and when you say the test results, what test results are you referring to?
When he came in 2022, I had ordered testing at GeneDx. It's a genetic lab, and we got the first test results. Then typically when I see patients several months to a year later, the lab will reanalyze the test results for us for free one time, which I asked them to do.
And so did you receive anything else from the lab regarding those test results?
Yes, when they reanalyzed, other than the COL1A2 gene, they found he had a deletion. He's missing a small piece of chromosome on the long arm of chromosome number 15.
Oh, the chat's calling out reading glasses. I didn't see it, but I believe them.
Do you know when
It's not on my card either. Dang.
I think August.
Ooh.
August
Reading
2024.
glasses.
Okay.
Yep,
Do you know
reading.
what the
There they
purpose
are.
of that visit was?
A follow-up visit to discuss how he's doing.
Okay. And was there an examination done of him on that day?
He has blue sclera.
Let me ask you for a second about the variant at COL1A2. It has been described in this court as a variant of unknown or uncertain significance. Are you familiar with that term?
Yes.
What does that term mean to you?
It means the lab cannot definitively tell us whether this gene change is going to cause a problem or not. And so typically what I tell patients is follow up with us in a 6-month period to a year to 2 years. In one patient's case, it was 5 years before the lab came back and told us the final result.
And how is that result obtained?
They reanalyze that. They look at the genes and the data, and then they look at the database, and they see if there are more patients who came up with the same mutation, what are the clinical features they have, and then they go from there.
So you're saying unknown significance could be found to have a significance?
Has there been genetic testing done on relatives of Jameson?
Yes.
And who has been tested?
Seems like.
Whenever we find a change in the child, we always go first to the parents, tested both parents. In this case, father carries the same gene change. Father also has the deletion on the long arm of chromosome number 15. And then mother didn't have it. Then I obtained further history from the father's side of the family. And I tested paternal grandfather. He also carries the same gene change. The reason I tested was there is history of hearing loss on that side of the family.
What does that tell you potentially?
Well, sometimes in connective tissue disorders, you can have hearing loss. May not be apparent at birth. It starts from teenagehood to adulthood. And the paternal grandfather told me he had hearing loss from teenagehood. And he said his father also had. The paternal great-grandfather for Jameson also had hearing loss.
That's interesting.
Were there any other health issues on the father's side of the family?
Yes, father, when he was a young adult, he had fractured several bones. And then on the father's side of the family, the father has several paternal uncles who had accidents, who had fractures. And on the grandfather's side of the family, the father's father, he recalls that too.
Are you familiar with the genetic disorder constellation of issues called osteogenesis imperfecta?
Yes.
And what is that?
It is again where the genes can either be called one A1 or called one A2. Majority of the patients have a mistake in the called one A1 where they don't produce enough of the normal collagen. The collagen is like a braid. It's a helix, triple braids. And in the triple braids, to keep the scaffolding very stable, you have glycine bridges, so-called. And so majority of the patients don't produce enough of it.
She's falling asleep.
But the other part is called one A2 where they make abnormal protein.
Oh, look at her. She's
And
like
so in
eating
this
your
disorder,
face.
The children are at risk for
Getting
they can have things
kisses.
like
Oh,
blue
and
sclera, they can
love
have
nibbles.
history of fractures, and sometimes
Those are the best
the
part.
fractures can occur with no trauma or very minimal trauma. For example, in the newborn period, you change the diaper of the baby, that can happen. And then it'll decrease after the early childhood period, then kind of normalize, then again it'll start up again when they become more active. And then in the older people, as they get older, ladies, for example, towards menopause, they will fracture again. But there's a great deal of variability even within the same family.
Have you had any, in your practice, any personal experience with children that have that wide degree of variability?
Yes, I have a family of 5. They all, most except for one child, most of them carry the same mutation. The father was much more severe. The children fractured. Some children fracture, some children don't fracture. So it's very difficult to say. And this is known as interfamilial variability. Why this happens, we are not sure.
Can an individual who has a connective tissue disorder, can it change, can the symptoms change within that individual over time?
Yes, like I said, in the infancy period, they might be fracturing, and then it dies down, then it starts up again when the child starts to become more active.
And you have seen that in your practice?
Yes.
Have you met with Jameson and his family since August of 2024?
I can't remember. I have to check.
And she like disappears every time she has to check her report. This little woman is so cute. She's so tiny.
But it was really interesting how she was really linking the paternal side, because we've heard a lot about Carrie's side.
Mm-hmm.
But again, this goes on to explain what the state ignored. And
Right.
The state's paste eaters, you mean? Yes, well,
Pretty
they would.
much.
They were too busy eating paste.
It wasn't, there wasn't an arrow sticker on the parts they were supposed to be reading.
I like how she disappears behind the witness stand.
Can somebody give her a phone book?
Okay. Based upon your meetings and your
Maybe she should sit on the medical records.
History, your review of
The ones the detective didn't
the
read.
genetic testing
Yeah.
that's been done, have you made a diagnosis of this young man?
Based on the family history of hearing loss, the family history of fractures on the paternal side of the family, and then his clinical features, he presented with soft blue sclera, he had fractures in the neonatal period. It is suspicious for a connective tissue disorder, but we will have to wait and follow up with the lab. It is my understanding that we will need to do further research on this gene. We're beginning to learn a lot more about these genes, and then in the future we will have better answers.
Okay. Thank you, ma'am. That's all I have for you right now. The other attorneys will have some questions for you.
Ms. Fox?
Oh, this bitch. I mean, Miss Fox.
Here she comes.
Good morning. First of all, thank you for talking to me last week. That was very helpful, and I appreciate your time in that regard. You had told me that during the first
What a
visit,
bitch.
you
Let me
were
be
able
nice
to
to you
get a
before I
pregnancy
screw you.
history in this case.
Right? Before I try and fucking
And that
hang you out to
pregnancy
dry.
history was that Jameson had a normal birth.
Yes.
And he was born vaginally, and
Yes.
the pregnancy itself was uneventful.
Yes.
That was information provided to you from the family?
Yes.
And then also at that time, something that was concerning to you and you asked about is whether or not Jameson had met the normal milestones.
Can I look at the
Absolutely.
I can't remember so much.
Yeah, we can check
He's
off
so
which
cute.
sighting. Which sighting? Damn, I don't have that one either. I'm gonna have to start cheating.
So the state had to
time he was
talk to
only
her
4
for
months
a
old, yes.
protracted
And that
period
was
of time
important
to
to you
understand
genetically
genetics.
because if he was not,
Well, the state are paste eaters, so there's
Fair
that.
point.
there's that.
meeting those milestones, you would have to look at other things for potential causes, correct?
Yes.
In addition, you were provided a number of medical documents
Yes.
to begin your case.
Yes.
And part of that included the 3-panel test genetically that was ordered by CHOA.
I think it was the Invitators that
Okay.
you're mentioning, yes.
And as part of that, it did initially note the variant on the COL1A2 gene. And you spent a good bit of time researching it and talking to different professionals to make a determination as to whether or
Yes.
not it would be an issue in this case.
Yes.
And as you already told the jury, the most common diagnosis for osteogenesis imperfecta is the COL1A1 gene.
Yes.
That was not an issue with Jameson.
No.
The only variant he had was in the COL1A2 gene that would have been a potential
Can you
issue
pause
in
it,
this
Megan?
case.
Yeah.
Yeah. Yes. Possibly.
Okay.
Yes.
Okay, Miss Osteogenesis, imperfecta. She is talking about a connective tissue disorder, not a bone disorder. So you have completely ignored the fact that she and every other genetic freaking person has told you that this is a collagen issue, not osteogenesis imperfecta. Now, again, you can have weak bones and it doesn't have to be osteogenesis imperfecta. It can be a connective underlying collagen issue. Why is she going here to disprove osteogenesis imperfecta when no one claimed he had that? In fact, through this entire testimony, I've been watching through the entire thing, they suspected it could be it, but they never actually claimed, oh, well, he has this. They've always said connective
But it's been important though to bring up that there are several conditions that could cause some of these things. But yeah, no one has said we think that he has this. But yeah, I noticed this too. Sakinat says, holy shit, she's speaking slowly like this doctor doesn't understand English. All right, I think we can check off. What a bitch.
Yeah.
What a bitch. I don't have that one either. Oh my God, I'm losing. I still only have free space. This is terrible.
Damn, gotta get some more cards, Megan. You gotta get 6 or 7 like the pros.
Yeah, I'm going to do 2 of them. Let me see if maybe I should just generate 2 cards so I have a better chance here because this is getting ridiculous. All right, here we go.
So after you did your research, after you made your phone calls, and after you did your initial analysis, it was your determination that the variant in the COL1A2 gene was not the cause of the breaks and you needed to do further research. Isn't that correct?
Not. It's very difficult to say because this is a variant of uncertain significance. So I don't know if I can mention who are the people I called or what research
You
I
can
did.
certainly mention all the people you called, but you're not allowed to say what they said. So you talked to Dr. Peter Byers.
Yes.
He is the renowned expert in the field in the United States and also in charge of the lab that did the test.
Yes.
You talked to, or you read the different records that were involved and the sub-studies regarding those records.
Yes.
And as you made a determination, the determination was that it was very unlikely to cause a problem clinically.
In my research, I don't know if I can say discussion, but in my research, I decided to do further investigation on this gene on the paternal side of the family.
Mm-hmm.
Because this is a variant of unknown significance, we have to test where the gene came from and go up the line as far as we can and see what symptoms they had.
Okay. Well, one of the symptoms that you've pointed to was hearing loss.
Yes.
Did you know that the family lived and operated around a drag strip in our county?
Oh my God.
Oh, for
Did you know
fuck's
that
sake.
Oh, for fuck's sake. Are you Brassy Lock's cunty behavior? Please check that off. My God. Did you know that they're deaf because they live near a drag strip?
Do you know what people around drag strips do? Ear protection.
Yeah. Are you telling me? So I'm gonna have ear loss because I lived underneath an O'Hare traffic pattern for years. I don't have any hearing loss. I had my ears tested. I've got ears better than most animals. I lived right underneath a traffic pattern. I had airplanes, big, huge jumbo jets flying over my house every day, all day long. A drag strip. This woman she will say anything. You know what? Making shit up. They're making shit up. This is made up. This is made up.
Bullshit.
So stupid.
Can we mark states doctors are paste eaters since they never decided to look at the paternal side, you know?
Yes. Yes, you can. Oh my God. This woman.
Drag strip can be heard from miles away.
I don't know what a drag strip is.
A race car drag strips.
Oh, okay.
Very loud noises all the time, consistently. There could be environmental factors that cause hearing loss.
This lady's a dumbass.
A drag strip is mostly dormant.
Right.
Until Friday.
The biggest ones have races once a week. The absolute biggest ones have races once a week. Do you know what else? They have noise cancelling fences?
Yeah.
Because the city ordinance
you can't go over a certain decibel. Yep.
Yeah.
Mm-hmm. We have one of those. There's one up on the other side of the lake or whatever, and you can hear it at night on Saturday nights. You can hear it when you're at the lake, like a little bit in the air. Mm-hmm. And but I've been actually to that track. It is not that loud. It is really not that loud. I mean, stop it. Maybe if you worked at a drag strip and you didn't wear protective ear coverings, maybe you would then have some hearing loss. Yeah, but in a house, you're in a house in a neighborhood near a drag strip and you want me to believe that you're going to have hearing loss? Come on.
Right. Maybe Brady's dad was a roadie for a Kiss impression parody band that worked at the drag strip. So he had to be there all the time. That's what in the hell? Ma'am, you are just making the case for taking fluoride out of our water.
Flux
or
got
at least
kicked out
of your hair.
She's back.
I don't know what happened.
Flux pressed the wrong button.
I was trying to edit my avatar, and I think I did remove from stage on accident.
Is that because you got very angry by some chance?
I got really angry, and I was trying to do this. I was trying to get the dumbass going.
Flux is angry. Flux is angry,
all the
chat.
wrong buttons.
That is such a, again, that's like if Johnny Cochran had said, OJ's hand swells up. He can't wear the glove. I mean, that's basically what they did. But look, they live near a drag strip. They're kind of, it just, again, show your bias for Appalachian people while you're sitting at the base of the Blackfoot Mountains, ma'am. Like you ain't got brassy hair, like you don't know what purple hair
did you also catch the disdain for where they lived? Did you know
it was
a drag strip? Man,
can you imagine this hoe?
Oh yeah, Nothing Burger. Check off nothing burger. That's right. The drag strip is absolutely a big old nothing burger. We're going to have to hear from Carrie too. How close is this drag strip and like how loud is it? Because I have a feeling that she's just making shit up. I don't have nothing burger on either card. Oh, come on. This is ridiculous. Oh, come on.
We need
the
to add a
bingo
square.
Is not on my side.
Panel cannot cheat on their bingo card.
Panel fails for cheating.
It was all that. It was the Shriners, the little cars.
Such as living by a very large drag strip that makes noise all over the county.
Yes.
What?
So, but at any rate, the bottom line on the analysis on the original reports was that it was very unlikely to cause a problem clinically, correct?
Am I allowed to read it out?
I'm sorry?
Can I read it out? No.
You can't read from it. You can use it to refresh your
Why
recollection,
not?
though.
Oh.
Okay.
Yours did all the time.
Variant of uncertain significance and unsure whether it can cause a problem or not, basically.
Unsure.
Unsure.
Okay. You also did the genetic testing on the parents.
Yes.
And specifically as to Carrie Timms, you found that she did not have any genetic anomalies.
Only for the gene change that we tested.
Okay.
Yeah.
So she didn't have COL1A2 in her
COL1A2,
system?
no.
And that's the one that's associated with Ehlers-Danlos Syndrome, osteogenesis imperfecta. She doesn't have that gene.
Yes.
Now, there is a subsection of Ehlers-Danlos that has no gene, the hypermobile kind.
Yes.
Did she share with you that she had already been to geneticist Kathy Stevens in Chattanooga?
I can't recall.
Okay. Did she share with you that a different doctor, being Dr. Kathy Stevens, had not diagnosed her with EDS?
I'm sorry. Who did this? Who did this?
I would watch the hell out of that remake.
Yeah.
Look at this! Who did this? Which one of you assholes did this? Please send more.
Yes.
Oh my god.
Oh, put him in Dude, Where's My Car? Dude, where's
you
my
know what?
extra feeding?
Stoned Archie Ruckus memes is going on the bingo card. Maybe that will get more of them.
You should have him next to a puppy and him yelling at him and like, Dad, I learned it from you.
Dave.
God, this picture.
Dave's not here.
With the one eye open, it just kills me. Look at it's the same look that's on Cheech's face. Oh my god.
Poor puppy.
Swan Lake Lady, you did that? Oh my god. It's so funny. Oh, I love it. Oh, please do more. Good to see you, by the way, Swan Lake Lady.
We need to put him in face of Spicoli from Ridgemont High.
I honestly can't recall.
Okay. Did she share with you that she scored a 2 out of 9 on a Beighton scale score for EDS?
Bullshit.
Yeah.
Okay. If you score a 2 out of 9,
that was a false
extremely
scoring
low for that scale,
Yeah.
isn't it?
Generally, it should be 4 to 5 or more, but there are other factors that are also involved.
Did she share with you that she was found not to have doughy skin?
I can't recall that.
Did she share with you that her scarring appeared normal?
No, they're just repeating
I
bullshit.
can't recall. Yeah.
Would you agree as a geneticist, if the Beighton score was 2 out of 9, the skin is not doughy, and the scarring is normal, there's really no point in testing further for Ehlers-Danlos syndrome?
It's a little bit more difficult because you must also look at other things because as people get older, they're not so flexible. And if those 5 basic points for the Baton score is not testing positive and you're suspicious. You have to look at the other joints like the shoulder, hip, ankles, and toes. And then the other family, other personal, other history will also be there, like history of maybe heavy cycles, maybe there are several other criteria you have to go through basically, because as you get older, if you're not having enough
Werther's.
look at the others.
Werther's.
Okay. Would you agree as a
That was a delayed reaction, but the judge definitely just had a Werther's break. So let's check that off on. Oh, I have that one. Do I have it on the second card too? No, but I did have it on one at least. All right, let's take a quick break here and get to some super chats because you people are nice. Billy Nice. Oh, that was a strange coincidence. Thanks for the $5 for Archie Treat Fund. Not those kinds of treats, though. He's had enough of those. Lizzie FP, member for 9 months. Fingers crossed Megan's power holds up today. Yeah, that sucked yesterday. I not only lost the Wi-Fi, but then shortly after we lost the power. And there were no storms. I don't know. New York is just like that. Rob paid thanks to the 5. The defense already attacked Santa. Are they going to attack Grandma next door with a candy bowl for the neighborhood kids as well when we get to cross? Yeah, probably. Tammy Fayette, thanks to the 2. Please check Super Tips. So, Tammy, I went over there and I did look, and I don't see a new one. I see the ones I didn't get to read last night on the show. Do you mean the ones from last night? I was going to read those on tonight's show. But I'm not seeing a new one. Oh, wait, maybe. Hold on. Wait. Oh, there's more. Never mind. 16 minutes ago. Oh, here it is, Tammy. I just found it. I found it. Okay, hold on. Let me play it. Thanks for the 5, Tammy.
I should have had this doctor check on my twins. They could still be here now.
Okay. And Tammy sent another one.
How can you like this judge better than me? Easily.
Yeah, easily, because Auntie Bev was the absolute worst. All right, moving on. Thank you for the support, chat.
geneticist that it is impossible to diagnose a baby or an infant with EDS right now?
By the way, Rosalind, you're ignoring the private chat.
Oh.
You've been
I
ignoring
always ignore it
all morning, and it's all about you.
Oh, what did I do?
Well, if you do the genetic testing and the gene changes are what is known as pathogenic, then it's easier. Yeah.
But there's no pathogenic gene testing positive for Jameson for EDS.
Not as yet.
Okay. You also did the genetic testing on Brady Timms.
Father?
Yes, on the
Yes,
father.
yes.
And he had the
I don't get the first one.
Qual1A2 variable of unknown significance. You never diagnosed the father with osteogenesis imperfecta.
He had history of fractures.
But his fractures was from a motorcycle accident, more as a late teen adult.
I saw only the child.
As Brady Timms, the father, his fracture was from a motorcycle accident. Lots of people break in motorcycle accidents.
That's what I thought, Roz.
Lots of people without osteogenesis imperfecta break in motorcycle accidents.
Yes, possible.
That factor alone does not mean he has osteogenesis imperfecta.
No.
In fact, you found that he had no history of breaks as an infant.
He started breaking when he was in his high school years, I think.
In a motorcycle accident.
Or something else also. He was an athlete.
An athlete?
Yeah.
So an athletic event broke his bone?
To my understanding.
I
But
hate
you
her.
never diagnosed him with osteogenesis imperfecta.
I hate her.
not
Megan
his
hates
doctor.
prosecutor. Is that on the bingo card? I think
It
we
should
all
be.
hate. I think it's
Panel hates
Panel
prosecutor.
hates
Yeah,
her.
panel hates prosecutor.
Yeah, agreed.
Can we check that off? Because I hate her.
I think that should just be the free
Yeah.
square.
Do we have
Let's be
everyone
real.
gets angry yet?
I'm already angry. I'm angry. I don't know
I'm
about
angry.
you.
Yeah,
We're all
everyone
angry.
gets
I hate
angry.
this cow.
I hate her.
Ooh.
God.
Which also means angry Swede.
Also, oh great, perfect. Because I didn't have. I didn't. Does the chat hate her? Chat, do you hate her? Yeah, because we could check them all off right now.
Ooh,
Donna says yes.
Flux angry. If
Oh
everybody's
yeah,
angry.
My notes are just like stupid bullshit, angry bullshit, prosecutor stupid. Yeah, those are my notes.
All right, so panel gets angry. Yeah, the chat hates her too. So chat hates prosecutor. Just check off all the hate squares, okay? Because the hate, I'm calling all the hate squares right now. God, this woman.
Okay. In fact, when I talked to you, you said the only way to do any further testing on him would be to do a biopsy, and it's very invasive.
Well, it is invasive, it is time consuming, and it's simple to order a test, but between collecting the skin, culturing the cells, it takes several weeks, and then sending it off to the Seattle lab. Between the first and the end of it, there can be many things that can go wrong.
Okay. When you had the GenDx reanalyzed, you said you were allowed to have it reanalyzed. You got the results back. The QUAL1A2 gene was still showing unknown variable of unknown significance.
Yes.
And just for clarification, the categories it could have been is pathogenic, likely pathogenic, variable of unknown significance, likely benign, or benign.
Yes.
That's the classifications you look
Yes.
for. So in the additional time frame that had went by, the lab has not reclassified that.
I have to reach out to the lab and ask them, but generally I did it a couple of months ago. They haven't reclassified, and then I can ask maybe in a year's time.
Okay. And when you did the analysis, it was very likely not to ever be pathogenic. Isn't that correct?
Difficult to say. Again, I would have to do the skin biopsy and do further testing and further research.
But that's what the test itself said. Not very likely to alter mRNA splicing.
And since then,
they don't understand the word likely. Like, what the fuck do you mean? Do you understand and comprehend English to the point where it's like not likely? That doesn't mean no. Like, where in our education system did we get so wrong where it's like you have no idea what English is?
And don't you remember when Jason Hood made one of the state's pace eaters define a word that was like, I can't remember what the word was now, but it was
sometimes. It was like define
it was
sometimes or something.
Define, either sometimes
Unknown.
or define the word unknown.
It was something like.
And then he tried to define it with the same word. He's like, no, you can't do that. You can't use the same word to define a word. Remember that? But you're asking the right questions here. Do they understand the English language? The answer is actually yes. And they're doing it on purpose. They are mischaracterizing the language on purpose. Cindy Absug is in the chat. Hey, Cindy, how you doing, honey? Love you. Says, is this live coverage or is this a replay? It is a replay. It was not streamed live. So the footage has just been released to YouTube, and we have been watching a bit of testimony every day so we know that the Timms were acquitted of these horrific crimes. But we are finding out how they got there. And it is, Cindy, it's nowhere near as awful as your case because they actually had decent attorneys who weren't trying to screw them. But I hear that the Hernandez case is going to remind us a whole lot of your case. While the jury did find them not guilty, they had a very uphill battle with a hostile judge and just awful. So we're going to watch that one too when it comes out. I said I would on the next break. I missed Rob's super tip, so let's get to that. Rob, thanks for the 5.
Don't look at me like that. I didn't call you fat, the vet did. I didn't go pouting to the kids behind my back for extra snacks. No, I am not going on a diet with you. Quit guilt tripping me, mister.
You should have seen him this morning. This dog, I fed him right after Hangry left on the bus. So like around 7:30 a.m. I feed this fat dog. And I gave him a nice big bowl of food and water. And then I gave him a treat because he was being extra, because he had a bad day yesterday, right? This dog, by 9 a.m., he is begging the oldest one. That's in 2 hours. I catch him begging her for her pumpkin toast. And she's like feeling sorry for him. He's got his nose right up on her plate. And I'm like, don't you dare give that dog any food. Don't you give him a bite. Nothing. I'm telling the kids now that when the dog does this to them, they need to give him a carrot, which he loves. He loves carrots. So it shouldn't be a problem. But like, I'm going to keep an extra bag of carrots to be like, no, you get carrot treats now. You are on a carrot diet. You are not to manipulate the children into. He gained 15 pounds in like 8 months, you guys. 15 pounds for a dog who weighs 100 pounds. That's a lot of weight.
That's a
That's
lot.
To be fair, I managed to pack on 50 during COVID. I retained a lot of Mike and Ike's. So
everybody gained the COVID 50. I mean, who's kidding who?
Except for those mutants who are like, I worked out the entire lockdown. I was like, go away. Go away.
I mean, I'm between 275 and 285, depending on which end of the buffet you find me.
Oh, we got Rosilla's realm too. Thanks for the 5.
What has 2,000 feet but only one father?
The Mormon Tabernacle Choir.
We are very sorry, Mormon chatters. I'm sorry, that wasn't me. I didn't say it. It wasn't me. That's pretty funny though.
Further research, and I don't know if I can say if I've spoken to experts. I don't know, but further research needs to be done. And like I said, it's difficult and invasive.
Okay. You also said you noted a microdeletion on the long arm of chromosome 15 at 15q11.2.
Yes.
That is not to be a factor in this particular case because it would not have caused broken bones.
No, but it causes developmental delay, and we have to watch the child as he grows up.
So this would not be a cause of the broken bones in this case, is my point.
No.
Okay. Jameson continued to meet all his milestones every time he came to your office. That's one of the things you checked.
Yes.
You also had the bone density scan done on Jameson.
Yes.
Came back normal.
Very difficult because I tried to do it, but the child is less than 4 years of age. Child shouldn't move.
Dogs.
And I don't know if I can say it. I spoke to the specialist, but research says that you should repeat it later again because there's very little data on DEXA bone scan of children at that age.
But the scan itself came within normal limits.
But she just said, in order to be accurate, you need to repeat it again because it often misses things. What more do you need?
Wait, the state is turning down a chance to medically torture children by having them sit still to do another DEXA scan? I mean, didn't they give him like 15,000 x-rays?
They did. They exposed him to radiation poisoning on multiple occasions. But an extra DEXA scan is just a bridge too far for these people. Holy shit. I hate her so much.
Yeah. Why conduct tests that can say I'm wrong? No, we can't have that.
Yeah, no, we can't have that. You know, why did everyone gain weight over COVID? Weren't we all taking long walks? I remember taking a lot of walks. Why did we gain weight? We were like walking every day.
I was drinking my weight every day. I was doing like, I'll just day drink.
Oh, it was the day drinking. That's right. That's what it was.
and the delivery of booze to your door.
The delivery of booze. Go anywhere. It was the day drinking. Oh. How could I forget? The day drinking was great.
Not to mention Mo, pre-streaming Mo was trying to get 4 children to online classes with our rural internet.
Oh, holy shit. Let me just say for a moment. I had a kindergartner who was supposed to be doing online classes at the time. It was so bad that we all gave up. All of us, within a week, we were just like, no, we're not doing this because I cannot, like, the poor teachers were like, okay, please mute your microphones. Everyone mute your, okay, Billy, mute. You have to mute your microphone. Billy, do you know where okay, no, Sandy, no. That's that was the entire class. Imagine kindergartners on a Zoom meeting. It was insane. Eventually I called the school and I was like, listen, send me home the packets. send me the paperwork. He's not coming anymore to this. We're not doing this. I will sit down and do the worksheets with him, but we're not doing this. And everybody quit. They were basically like, yeah, you're right. This is pointless. We'll see you guys in the fall, like.
Yeah, I basically gave up with my kindergartner and preschooler. I was just like, no. Because then the girls were like, we don't have Wi-Fi to do our Zooms. And I was like, that's it. You're all learning how to make bathtub gin, and we are doing a dissertation on Futurama.
We're learning how to do bathtub gin. Wait, no, my favorite part of the Zoom COVID experience was my daughter is on a Zoom class. She was in high school. She was a freshman. She's on a Zoom class in my dining room, and the speakers are on. I can hear this class. I'm in the kitchen. I'm doing things and I'm listening. I just happened to hear this teacher say that Donald Trump told people to drink bleach. And I come around the corner, like literally this is me.
Oh, no.
What? And I'm gesticulating to my daughter. What did she just say? What did she just say? This turned into, and my daughter had been recording because she's no dummy. She started recording as soon as this happened. So I sent the recording to the superintendent and I was like, what the hell is this shit? What are you teaching my kid? Here is the evidence that this is all a lie. Here's the evidence that he never said this thing. And I want her to apologize to that class. Do you know what he said to me? You will never, this is so funny. He goes, our students sign a electronic use policy and there is no recording in the classroom. I said, excuse me, sir, you're in my goddamn dining room. I can record anything I want to in my house. This is my house. This is not your classroom. She happens to be in a class in my house. And you think you could tell me not to record? This is a one-party state, sir. I know my rights. You know what happened after that? He called the teacher. She ended up giving an entire dissertation to the class on fake news and how she fell for it.
Nice.
Mm-hmm. Yeah.
Nice.
Well, he never said anything after I said, are you kidding me? This is my dining room. You will not tell me what to do in my own dining room.
Well, imagine being a large family going to Costco during the coof. I was like, I'm not stocking up. This is just my normal grocery run. Because they're like, oh, are you a prepper? I'm like, no, I just have 8 kids who are at home all the time now. Would you like to donate to my snack fund?
Oh, man.
And over here, basically nothing changed in Sweden. Kids went to school.
Yeah, I remember that. I remember reading reports about Sweden and how you all were killing it. You were absolutely killing it, just going about your normal lives, and everybody was fine.
Yeah, I mean, we had a little bit more distance than we usually have, but we are already more or less in voluntary isolation.
Can we put USA dumb and proud? Can we mark
yes.
that?
Yes. Dumb and proud.
The biggest thing that COVID I took away that I'm like, why can't we do this forever, was people having the space in public. Like if I'm at the grocery store in the line, don't be up on my ass. What the fuck is wrong with people? Why?
Yeah.
The norm?
I know.
Stay away
Flex
from
and
me.
We weren't getting into these hostage conversations, in Walmart where you're just trying to be nice to the old man who has the vet hat on, but you're just saying good morning and then you're like leaving and then he's like, he starts talking to you and you're slowly walking away. So he walks with you. Like he hasn't gotten the universal, I'm an inside cat. I didn't sign up for this thing.
And then they're like, oh, I know. My wife tells me I could talk the hind leg off a mule. You probably got somewhere to go and you're still trying to back away and he's still following you.
I mean, and you're getting scared enough that you're about to pull a Tawanda and just run him over and like hope you get a jury full of inside cats that understand that you are under attack.
Yes.
Okay.
I've been there.
We have to break the derailment somehow.
My mother died.
What proof do you have that your mother died?
My mother did not die.
So good. I think so, yes. Can I don't know if I'm allowed to look. I can't remember. I didn't give much
I hate her stupid hair clips.
repeat the testing again at some
Yes.
point.
They are uglier than sin.
Wait a minute. We have to go back to that because we had a good close up there. What even is that?
It's like
is that Tetris?
Glass window.
It looks like an. It looks like a badly played game of Tetris.
It looks like it's like a Santa Fe kind of thing, and you think she would have worn it with the poncho. Also, how do you mess up your hair color that bad? Do you pick like harvest yellow and ash blonde and go whatever? Like, do you mix both boxes of red $3 Clairol? What are you doing here?
All right, the chat is confused about what squares have been called off already, so let's do that. Let's give you an update. Let's go to my first card, shall we? Brassy locks Cahunty behavior. Judge takes a Werther's break. Making shit up. Free space squirrel. 15 minutes obligatory bullshit. Panel hates prosecutor. Then we have angry Swede. Chat hates prosecutor. States doctors are paste eaters. USA dumb and proud. Then we have unknown significance. Obligatory bullshit. Already said that. What do you do here? Reading glasses, witch sighting, what a bitch, Flux gets angry, nothing burger, and chat what? I wrote something down. I think it was chat hates prosecutor. I think I already said that. All right. That's where we're at. So are you all caught up now on the bingo? I know you guys don't like to get behind. You get very upset when you get behind. So make sure that we have everyone. Do we have any super tips I need to read? Nope, we're good on that. And there is a super chat or two, though. Let's see. Mavia, thanks for the 5. The only thing imperfecta here is the prosecutor's dye job. Dumbass needs a second opinion on that haggard mess. Yeah, I don't understand why she doesn't use the purple shampoo. She needs it. Maybe not. Thanks for the 2. Squunch or no squunching?
Oh, Dora the Explorer.
Oh God, squunch or no squunching? Razilla, I'll allow it. I didn't have Conti, but I marked the C word. I'll allow it. How do these people sleep at night? That's a very good question, Wanda.
Upside down.
I don't know. Upside down, possibly in a coffin with some dirt from Transylvania, I think. Upside down.
I've been there.
Mo, you're so quick. I love you.
Oh, well, my daughter is taking over the weird words.
I would have to go back and look at it again.
Nice.
Yeah, I brought only the genetic test results.
Okay. The fact that the bone test, density test came back normal, that would be an indicator that he is a normal little boy, though, isn't that correct?
I would have to look at the results to look at it further. I don't think, as I recall, it didn't give much information.
Look, let me just say something. Let me explain. So tomorrow we have an appointment for my middle daughter with the geneticist, actually. And it's a follow-up appointment. The first appointment that we had, she did the testing, and the testing came back completely normal. However, there were no unknown significance, nothing. Everything came back completely normal. Thank God, right? However, she showed signs of hyperflexibility during the same test that we saw with Carrie and that they're talking about. She had multiple. She scores way higher than a 2. I guess it would be she can do the elbow thing. She can do the. She can go to the floor with her palms on the floor. Actually, she can go beyond that. She can her thumb goes all the way down to the. It's gross. It's really gross. I can't watch it. It makes my knees hurt. She can do this thing. Oh, it's just. Ugh. She can do this. She can like pop her shoulders out. So anyway, they made her a follow-up appointment. She now has a geneticist. She has to go to a geneticist, and she also has a cardiologist, because there are conditions about that do not show up in genetic testing, first of all, that also have to do with collagen and hyperflexibility that could impact her heart and could show up later on in different things. So now they have to keep an eye on her, even though she has no markers of unknown significance. She has nothing on her genetic testing. She still has to go. So I don't.
It might
so
be
her
abuse?
saying, yeah, it might be abuse. Yeah. So what you're saying is it might be abuse. So it's interesting that that Brassy Lock says to her. So it's an indication that everything's normal. He's a normal little boy. No, that is not what the indication is. The indication could be we need to continue watching this for further significance. Duh.
Yeah, or it could be like me when they were trying to figure out what was wrong with my leg, because the first doctor said, well, you fell into a drainage ditch on your left side. Your leg's going to hurt. And I was like, yeah, but lightning striking and worse than childbirth, it's just probably inflamed. Then they sent me to a surgeon. Then they sent me to that said, nothing is correctable by surgery. I don't know what's wrong with you. They went, then they sent me to a nerve or a physiatrist, and he was the one that finally diagnosed me. But according to the other two doctors, I would have been relatively normal, clinically to every other patient they had. So until he starts expressing something symptomatically, or they do more, because what they're basically doing when they're looking at the unknown significance is they're looking at a database of everyone else who's had a call one, whatever they're talking about, and if they showed anything clinically. So it's not an exact science. They're waiting for the database to increase. That's why they said you need to, reanalyze it every several years. So I just hate this prosecutor so very much.
I just hate that she's trying to make it sound like she knows so much about everything. It's like, this is not how science works. Just because you do not know what's underlying does not mean there's not something there. And and clearly he did not test perfectly normal in everything. He didn't. He had 2 factors that were of unknown significance. He had another thing in his blood that I can't remember what it's called now, something 7 or 9. So there were absolute markers there that there's something else going on. And I'm sorry, those pictures of the capillaries, seeing his entire capillary structure underneath his skin, there's something there. These people are morons. The fact that they got this far pisses me off. This should never have gotten this far. They should never have been able to bring this case. And these Georgia prosecutors ought to be brought up on charges themselves for maliciously prosecuting the people of Georgia. I'm sick of this.
And screw Ms. Fox for thinking just because her children have OA or OI that she knows everything about that. I would never presume to tell someone else with CRPS how their stuff is, because it's such
everybody's different.
A nebula, a galaxy of symptoms that you can have. And not every case is going to look at. So she is one of these annoying people that continues to post like, just try microdosing. No, stop it. I wish also Indiana make microdosing legal.
And I'm over here. If I'm a jury, I'm like, oh, it's very apparent that she's trying to pretend like she knows like a whole lot. And I'm over here like, well, if you know so much, why are you a doctor? And why are you not a doctor? And why are you a lawyer? Like, go do that if you're so knowledgeable about it, which you're not.
Exactly. And I don't like any of this. This is just I'm glad it had a happy ending, but man, I can't even imagine. Think about how angry we are. How angry do you think Carrie and Brady are sitting there through this? I don't know how they kept their composure. I would have been throwing staplers at her head.
Especially after the drag race thing. I mean,
yeah, that was pretty bad.
Jesus.
That was stupid.
Oh, and don't forget, guys, the Carrie and Brady Timms fundraiser link is linked in the description of this video. The fundraiser is not over. They owe over $100,000. We did an amazing job. All of us together with the chat raised $9,000 for their first goal. But there are more goals to go because they owe their attorneys a lot of money, and we want to try and help them out. So if you have extra money this week, if you've got extra Starbucks money, you don't need to spend at Starbucks, go throw a 5 or a 10 over to the Carrie and Brady Timms fundraiser, because we are going to try and help them get out of this gigantic hole that the prosecution dug for them, because there will be no justice. They have total immunity. They have total immunity for this malicious prosecution that they did. They cannot be held accountable. Our laws don't allow it, which are really stupid and should be changed. But in the meantime, the American people can come together and help Carrie and Brady get their life back on track. Their life was stolen from them, and that should never have happened. Their baby was stolen from them for 3 years, and that should never have happened. So if you want to go and help them out today, please keep going to the fundraiser.
Megan, I figured out how we get them back.
How?
Okay. She really likes her plaque, and it's the best job ever. So we send them out an awards for, we don't tell them what the awards are for. But it's the Golden Cahoot, and it's, we'll say it like we are, recognizing exemplary female achievements in law, but we don't tell them their achievements of stupidity until they get there, and then we just roast the shit out of them. I'm pretty sure that doesn't break any law.
This is a great idea. By the way,
speaking of one of these,
yes.
Wait, let me make you bigger. Let me see. Do that again. No, but that's too obvious. We need to send them something they'll actually put on a shelf. What's funny is that in my river dancing video, there is a moment in here where I notice and I point out to my there it is, literally a tree in the forest that looks exactly like a vagina. Look at
The spirit of Verena was with you that day.
I was like, look at it. Look at it. Look at that
living
tree.
scrunchie.
Look at it. I mean, oh wait, I went back too far. Look at it. It's so crazy. I look crazy. Hold on. Wait, there. I'm pointing at it. Look, girls, look. It looks. You may not, and they were dying laughing. I was like, oh my God, the trees are trying to tell us something. This is like the vagina monologues in the woods. Please go ahead and check off river dancing if you have it on your bingo card, because you now just got to see a little sneak preview of my river dancing video, which, I mean, look at the scenery though. Look at that waterfall.
That is really pretty.
Woohoo. We had to hike all the way back there. Luckily I wasn't in the dress for the hike.
How did you change in the woods?
Well, that was funny. Have you heard of a Hawaiian bathroom?
No.
It's where someone holds up a towel and you just change in
Gotcha.
front of whoever. Although there were hikers on the path in the woods, they may have gotten a glimpse, but I'm good at quick changing. So, but in New York, being topless is legal. We've already discussed this. You can go tits out here and it's completely legal. So I didn't.
You should have just yelled, "I'm getting my vitamin double D. Shut up."
Tit talk may now be checked off the bingo card. No, I didn't cheat just to get closer to bingo. All right, maybe panel cheats. Panel cheats can also be checked off the bingo card.
Oh, good Lord.
Oh, I don't have panel cheats.
You can tell when we're closer to Friday because we get through remarkably less testimony.
Oh, you want to know where I am? Well, it is a well-known little place called Grimes Glen. And it's a place where it is really beautiful. I mean, it was one of the first places I went to in New York to see waterfalls when I found out that there were this place is famous for waterfalls. I didn't know that.
Did you go to Payson Waterfalls?
Yes, I did. And I will tell you that I have never been to a place in America with more waterfalls than
As long
Hawaii.
as you didn't pick up any scrubs, we're good.
No scrubs. No scrubs. But I mean, there are waterfalls here you cannot believe how many. They're beautiful. They're everywhere. And that particular hike, that's just the first waterfall. There's one at the end of the trail that ends in a swimming hole where everybody goes and swims.
Ooh.
And it's even bigger. It was very low water for some reason that day. And because we've had a drought, so it wasn't running. Normally it is rushing, like you can hear it. It's falling water. Like it's great. Absolutely great. When will I do another fake pregnancy update stream? That's coming soon. I'm probably going to do a couple pre-recorded videos to release tomorrow and Saturday. I don't think I'm going to do lives because I just can't find I can't find the time. It's not happening. I'm trying really hard to find the time, but between the trial stream and the regular show that I do at 8 p.m. and my kids in school and stuff and the homeschooling, I just don't have the time. But I promise to do some pre-recorded ones to get caught up. All right. What about touching the witness? Can I touch the witness? Excuse me, what now?
Oh, no, you can't.
Don't touch the witness.
Unless one of you have it.
I think she's got that look on her face like, God, are
she
you
said
really this
approach.
stupid?
Thank God she said approach.
I recognize that face.
Don't worry,
this woman's
chat.
Thinking, I know.
I already
Indian-
got doxxed. It doesn't matter if I'm specific. I've already been doxxed.
The basic thing is that we have to have more information on bone density on children of this age before we can conclusively say yes or no.
But the lab itself said it was within normal limits.
But I'm not the.
If they don't have a database of young children, they don't know what normal
The
is.
final say on this.
Wait, Your Honor, may I boop the witness's nose? Listen, Chad, I'm not worried about being doxxed anymore because it already happened, and that asshole put out actual photographs of my house and my children's names and my address and everything else. So here's the thing. You've got unafraid Megan now. I don't think you wanted unleashed Megan, but that's what you got. Because now, what are you going to do now? I've already been doxxed. Like, what are you going to do to me now? So, yeah, I don't care. Well, yeah, I suggest that everybody just be fucking careful when it comes to me now, because I have no restraints on me. No more strings. No more, I can't say this or that, or people might find out where I am. Nope, that's done. That's done.
No,
you
she's
can
gonna
only do
cover
that
you
to
in
me
kibble
once.
smell, and then Archie's going to attack you.
Yeah, that's right. Just remember, I have a 131-pound German Shepherd who really fucking loves me. So you just watch out, because there's not going to be any problems here.
I had, how shall I say, discussed with experts, and they are not sure themselves. So they asked me to repeat it again. I don't know if I can say that.
In addition to having the bone density test done, you also did a more extensive gene panel test on Jameson, the 67 panel test.
Ceiling cat.
67 panel test, I think, was by Invitation.
Shoot, that's not on the bingo card anymore.
I had done the whole exome sequencing.
NVIDIA test?
No, I didn't do that. They already came to me with the test results.
So someone else ordered it?
Yes.
And you analyzed it?
I looked at it, yep.
Okay. And in that, again, the only variant that would be even a potential issue is the Qual 1A2, and that particular test also says that that is not known to be pathogenic at that time.
We've already discussed this,
but
lady.
In my further research, we need to do further testing.
Further testing
At
has
the
always been the
End
answer.
of the NVIDIA test, there is a guide on how to interpret the VUS.
Yes.
Oh, you're going to tell her
Did you
how to
read the guide
interpret
when
it?
you read the test?
Yes.
Holy shit.
Specifically as to what the results mean for you.
Okay, rude. Check off rude, and also hair talk, because we
Rude.
did talk about her hair.
Yeah, the look that the doctor gave her was, I'm a polyglot and English is like my sixth language. Do you not understand I need to do more research? How can I better explain to your Appalachian ass that we need to study this more?
Yeah, how many more times and in what languages does she need to say it for her to understand it?
It says no significant genetic changes. That would be pathogenic variants or mutations were found in your genetic test.
Yes.
However, your test did find a genetic change called a variant of uncertain significance
Yes.
in one more of the genes tested.
Pardon?
That's what it said.
Yes.
When we see a genetic change but are unsure of its impact on health, it's called a variant of uncertain significance.
Yes.
It was unknown a few days ago.
Right now, there is not enough information about the VUS to know whether it causes disease or not.
Yes.
A VUS is a common type of result.
Yes.
We all have many genetic changes that do not cause medical problems.
Yes.
And most of the time, we later learn that a VUS is not related to disease risk.
Yes.
Most of
So
the
test
time.
itself
Not
says
every time.
more
She's
times
making
than not,
want to
it
choose
comes back
violence.
that the variable of unknown
just wanna-
significance is not even a factor at all.
Oh, did I add bitch
And in
slap to
this
the?
particular-
I think I did.
That's
She's
what I
making
want to do.
She's making me want to do both assault and battery allegedly in Minecraft.
I think that I added. If you have bitch slap on your card, you can check it off. I think I added that. I think that was a new one.
Yeah,
bitch
I
slap.
had it.
All right, awesome. You can
Mhm.
check it off now. I don't have it on
That's
either
like-
of my 2 cards.
Hey, Megan.
Yes.
I'm gonna have to bounce. I've got clients blowing my phone up.
Oh, okay.
Okay.
We love you.
We love you.
Love you, Rose.
Enjoy your bitch slap.
Thank you for being
I just
here.
want to.
Bye,
I
chat.
want to take her head and just
squunch it
against the wall until she understands what she's saying.
I
Get
want to take her to
squunched.
the groomer. I just
Get squunched.
Take her to the. You know, she does remind me of like a French poodle. You know,
I'm
wouldn't
telling
it,
you,
I would like to
see one of
her.
those poodles you'd have to muzzle and like crank.
I want to see the cone of shame.
Yes.
Oh no, shame. All right, I'm gonna let you check off circle squunch.
Meme
because,
makers, can you make a cone of shame for the prosecutor?
Wait. There is someone put a meme on my Twitter of a dog in a cone of shame that somebody glued a couple of olives to, making it look like a martini. It's the funniest thing I have ever seen. Hold on, I have to find it so you guys can see it because it's so funny. It would make a great Halloween costume, but of course the dog is looking at you like, "Oh my God, F these people." You look at this. Look at this. Humans are jerks. We need this on the prosecutor.
Oh, yeah.
Yes.
That's so cute.
Someone was like, Archie, it could be
That
worse.
explains her questions. She was 4 martinis in. She's like, I am smart. I am powerful. And I have long hair.
Oh, God, this woman. I can't stand her.
No.
All right, moving on.
Particular case, it's unlikely to cause problems because the variant he has is for the receptor on the mNRA. And because of that splicing, it's.
Hold on. We have a certificate. This award is for the Golden Cahoot. This award is presented to fill in the blanks for outstanding achievements in blank, the Golden Cahoot Committee.
We just call it the Golden Sea.
Oh, is that our cult name? We
Oh,
are
the Golden Cahoot?
We are the Golden Cahoot cult.
Yes.
I say we can.
Oh my God. Oh my God.
Probably not.
Oh,
ever
you know
gonna
what?
cause-
You're right. Oh, the chat's right. I am going to add a square for tomorrow, or well, not tomorrow, for Monday, that says state drives us to day drink.
Yes.
State day drinking. Yep. Day
Yeah,
drinking.
usually I've been doing
commences.
that on Fridays.
Or make you want to hit that medical grass.
Yes.
Also, yes. Okay. Well, we'll put for flux in parentheses THC. There we go. There we go. All right.
Problem in his whole life.
I can't say that, unfortunately, because as I said, since my further research, I've been advised by experts, or I have done research and think that we should do further testing on this family, and the experts will help us look at the skin biopsy, although it is very difficult to do, and they will look further to see whether this spelling mistake actually affects the splicing function.
As part of the records that you collected in this case, you collected the bone scans, like the x-rays, the skeletal surveys, these surveys of the head.
Whatever was from children's, yeah.
Okay. In addition, you got the rereads that were done at Texas Children's Hospital, didn't you? And why were you collecting the rereads in addition to the original children's healthcare scans?
I thought that the Texas person had done a second opinion, and I wanted to see I just collect the results to see.
Okay. And the second opinion stated that Choa read the scans correctly, didn't it?
Yes.
So there was, in fact, 3 broken ribs and a compression fracture.
Yes.
And then you also got the second opinion on the Erlanger scans from November of 2021, didn't you?
Yes.
And the second opinion there said there are no breaks at all.
Yes.
In no scans, in none of the readings, did you find any evidence of metabolic bone disease?
I cannot comment on that. I can only go by whatever report is there because I'm not unfortunately.
They didn't report metabolic bone disease.
Yes.
Okay. Specifically, even as to his head, the head exams came back normal.
Yes.
Would you agree that it's better to have an x-ray or a skeletal scan read by a pediatric radiologist?
Yes.
Why is it more important to have them read by a pediatric radiologist?
Because they would know the variabilities in the children compared to adults.
Okay. Is there more training that goes into a pediatric radiologist than just a general doctor or a radiologist?
Yes.
Okay. Do you find it helpful to look at the reports from the pediatric radiologist in the cases that you studied?
Yes.
You had a couple errors in your own report, didn't you?
Yeah, I don't type very well, and I talk into a system, and it doesn't always put the right thing.
One of the errors you made was you said that Jameson had bulimia.
No, it's not bulimia. With my accent and the typing thing, it goes way off sometimes.
Yeah.
Oh,
Bulimia is like when a high school girl's throwing up.
Oh my God! We just said it's because of my accent, you mother.
Not to mention the characterization of bulimia being a teenage girl, which, when I had it, I was a teenage girl. But to boil it down to that, again, she is so dismissive of anyone else who isn't her. And that has to come across because right there, that would have thrown me out if I was a juror.
This is horrific, horrifically rude. And I think we've gotten all of the bingo squares that are... This woman, we need more bingo squares for this bitch.
I'm telling you, the Golden Sea by a woman-owned panel.
I would be sitting in the jury box fixing my glasses the entire
Flux and I would have to move
testimony.
Because we would be like,
yeah. Oh, you know what?
Like, yeah.
We forgot to put, I'm adding the double finger salute to the bingo card because this is the moment. This is it. Right here. This is it. How dare you? This woman, so not only does she talk slowly to a woman who has an accent, but now she is holding a mistake that is clearly a mistake from the reader not being able to understand the doctor's accent. And she clearly, oh my God. This woman is like, can we say racism? Because it sure seems like, yes, my blood pressure meds are no longer working. In fact, you know what? I know where the blood pressure cuff is. Shall we confirm it? I think we need to confirm it since I have
let me go
cuff.
get mine.
Yeah, get your blood pressure cuff.
It's like the new version of dabbing. It's just...
oh my God. This
God damn, she's pissing me off so bad. Like, how can you be such an asshat? Like, how do you have such little,
if all you have ever done with your law degree is prosecuting people, then you turn into an asshole.
Like, I don't understand how I am a firm believer that every lawyer and or prosecutor should take an acting class, like in college, because you need to be able to like convince people of your emotions. If you might not have them, you need to be sincere. And if you can't at least act sincere or act like a human
what are we
fucking
even
being,
doing here?
people are gonna hate you. Like, geez.
All right, here we
man,
go.
I want a blood
Acting
pressure cuff
classes.
too.
You need also you need linguistics classes. I mean I read poetry because it helps me with the flow of words.
Is this thing even working? Yeah. It's not working. Oh, it says it needs a battery. Damn. I can't go get batteries right now. Come on, just work one more time.
I have a double A.
Are you sure that was the pressure machine?
I know that didn't sound like
you need a double A.
Machine.
I can just pass it to you.
I need triple A's. I need triple. This is
we'll pass
terrible.
it up. Oh man, if we each had a battery and we could just pass it up, that would be funny.
That would be
actually
funny.
She's making mine high, which it never is.
That's
it's
a good
never
thing,
been
right?
this high.
That's a good thing. That's a good thing. Well, now I have to go get batteries but I'm just going to go ahead and say my blood pressure is high.
Megan,
well, let's see what my heart rate is.
If you have to do it all the time, this is actually a good one, and it doesn't have a tube. I got it. It's tubeless.
I hate this one. I need a new one. I don't like it at all because if you have it in the wrong place, it doesn't work. Where did you get that?
Amazon. I just looked for a wireless one. So because I have to do it standing up, sitting down, and kind of. I figured if I got it.
Do you find it to be accurate? Because I feel like this one is not accurate at all.
I will say that my husband told me not to do it over clothes. So the closer you can have to skin on
to your skin
contact,
is better.
Yeah, and no, I messed up. I told Mr. Mo that Prime Day was 9 and 10 because I can't do time anymore apparently. So we missed Prime Day.
Oh wow.
When was Prime Day?
I think I got something on it.
I think.
Oh, I got Hangry's. I got Hangry's Halloween costume. He got an inflatable one this year. Him and his best friend are going as inflatable costumes, and it's the one that looks like you're being kidnapped by an alien. It is so funny. He put it on and he was doing his best acting, pretending he was getting kidnapped by an alien. It's going to be hilarious. This Halloween, I am killing this Halloween. The girls, my middle daughter and her best friend are the weird, creepy twins from The Shining, and I found them these dresses at Target, which were on clearance for $9. They look like little girl dresses, but they didn't have the ruffled sleeves. So I got them white t-shirts and I sewed ruffles on the sleeves. And let me tell you something. And then I dyed the dresses because they weren't blue and they really wanted baby blue dresses. I dyed them. I've never done this before. They came out so freaking good. They look so amazing and they look alike anyway. They have the same color and same length hair and like they look hilarious. It's going to be so they're going to walk around the neighborhood holding hands and just creeping people out. It's going to be great. Can't wait.
Nice.
You also sent the vitamin D test on the wrong child as part of your report. I won't say the child's name because I'm sure HIPAA protects.
Oh, show me.
This little girl. But the report that you sent is for a 6-year-old little girl.
Oh, what happens is this, when the system comes in through the faxes, sometimes my staff, when they put it in automatically one after the other, it goes into the wrong chat.
Yeah. So the vitamin D deficiency that was served on the state is actually from a 6-year-old little girl.
Well, it's easy to correct that, dumbass. You just did.
Jameson's vitamin D was normal, wasn't it?
Yes.
And in fact, you looked at it and confirmed that through CHOA's records as well.
Yes.
So why bring it up, you dumbass?
For reputation. I mean.
You indicated that you had done a great bit of research in this case. My first question would be, are you familiar with the article Hypermobile Ehlers-Danlos Syndrome, also known as Ehlers-Danlos Syndrome Type 3 and Ehlers-Danlos Syndrome Hypermobility Type?
Yes.
Okay, I'm sorry, but the memers are at it again. Oh my God. This is so good. Corporate needs you to find the difference between this picture and this picture.
Yes. Hell yes.
They're the same picture. Look at Archie Ruckus is making the same drunk face as Dr. Brown. Oh my God. Oh my God.
Oh, that's amazing.
That's
awesome.
Who did this? Was this also Swan Lake? JKD Buck? Who was this? Who did this? Yeah, JKD Buck. Thank you. That is hilarious. God, I love the memes. The memes are so good.
That was authored by Brad Tinkle and Marco Castori, isn't it?
There are many articles. I looked at the articles from Gene Reviews.
May I approach the witness?
You can.
Is this one of the articles that you reviewed?
No, I didn't look at this article. I look at the articles on other articles on PubMed and on Gene Reviews. Gene Reviews is a website all geneticists go to, and we look at articles from there.
Well, I've got a few more, so let me see if I can get one that you've actually looked at. That particular article you have not.
No.
Okay.
Let me see if I can find one that you've actually looked at.
I mean, we gotta get this lady a shovel, because the one that she has that she's digging this hole with, it's gotta be getting low. It's gotta be wearing out pretty soon and about to break. She just keeps digging.
I am dying to know what the juror thinks about this. I wish we could get this juror to come and talk to us. Maybe I can just communicate with the juror by email. I have questions.
Ooh, I could make a puppet and then they wouldn't have to join on stream. Look, I spent 3 hours making a Hank Brennan puppet. I need to do something with it because it just stares evilly at me. And I'm afraid to burn it, okay? To be honest, I don't know what kind of Stephen King bullshit I'm going to deal with.
You made a Hank Brennan? You made a Hank Brennan
I'll go
puppet?
get it. Yes.
Go get it. I'm dying to see this. How do you have a Hank Brennan? I want to see, how does she have this? And I've never seen it. This is going to be hilarious. I've made sock puppets before of a character in the Library Wars that was hilarious. I used to make YouTube videos with her lying to the press about what was happening in the library. And it was a sock puppet with yellow hair. It was called Fidget Mittens. She was the representation of Bridget Bittman at the library. Fidget Mittens was the, I actually took Fidget on a tour across the United States. We went to Washington, D.C. Oh my God. Shut
with the bald spot.
Oh,
I lost his glasses somewhere, but this was 3 hours of me looking deeply into Hank Brennan pictures, for which I may need therapy. Mr. Mo came in and he's like, "What the hell are you doing?" And
it is so creepy. Hold it up to the camera again. How did you make that face? Did you paper mache it?
I used some clay on top of an egg shaped wood piece because I thought I could get the nose. Look, I can't explain why I do the things I do, because Mr. Mo was like, "Why did you just spend the entire day to make a puppet?"
Did you bake it?
Like,
so it's
it was
hard?
air dry clay, and then I painted it over it and did his little bald spot
my God,
that he pretended we don't know.
It's hilarious.
And his big old nose and stupid face, and then I don't know where his glasses went, but he had glasses.
Oh my God, it's hysterical.
This is why Mr. Mo hangs with me, because he's like, you forget Amazon Prime Day, but sometimes you spend 3 hours making puppets of a weird, creepy nature.
That's the ADHD. I'm sorry, it's the hyperfocus. It's either that or autism. I'm not sure. It's one or the other.
I don't know. I did do something on Mornings with Mo where this guy thinks, now it's a small study of I think 300 people that claim that they were abducted by aliens. But he says that the early genetic tests are back, that they have been hybridized with ETs. And that all neurodivergence, like from Asperger's to ADHD, can be explained by this alien hybridization. And honestly, this has been the best day of my life because it explains why I can't human. I am totally willing to buy this theory.
Me too. I like
part
it.
ET. This makes perfect sense. This makes perfect sense. I've never been able to human with you guys. I always feel like Jane Goodall with the chimps.
But wait, is it reptilian DNA though? Because I really don't want to be one of those.
I mean, it does explain that I like, just lay on hot things.
Yeah,
and
I was going to say
generally
it explains
cold.
my
I almost ruined my keyboard over that. How dare you say something like that when I have a mouthful of hot tea? That was almost really bad. I like to lay on hot things. Why I take the clothes out of the dryer and immediately put them on?
Yeah, it makes perfect sense. I am a reptilian. It's not just, mean people like Hillary. There's good reptilians like me.
Is your case rare or real?
On PubMed, there's many articles you can go to. I may not have looked at that article. I would have looked at some other article, and I didn't print those.
Did you look at that article?
No, not this one.
Are you familiar with the article, Fracture Prevalence in Children Diagnosed with Ehlers-Danlos Syndrome and Generalized Joint Hypermobility?
Again, I wouldn't look at this specific article. I would have looked at
The
other
chat is
articles in
concerned about
PubMed.
Nick.
And I don't print those out. I read through it and then I just take the information.
I made a meme back in April with Brandon, and I'm trying to find it.
That's what it is. See, he's concentrating.
We all have ADHD, so now half of us are thinking puppets.
I have this resting serial killer face when I'm concentrated. My apologies.
We can't hear you.
I would have looked through many things. I would not necessarily type.
Speak into the
print
microphone.
everything out.
So she's just going to walk up to her with 800 articles that she didn't read.
Hypermobility.
Why is she always wearing like
does
Argyle
not
as a
have
pattern?
broken bones as a factor for determination.
Can't you tell she's
There are
Scottish,
other
Flex?
kinds of EDS, but hypermobile specifically does not. It's not diagnostic.
Actually, her dress might not be Argyle. Never mind. It's just a
And I've
weird
seen many
pattern.
patients with hypermobile EDS.
I don't get the
Accompanying
sexy boots
history
with the
of dislocations
boxy outfit.
and very often fractures.
In
I don't get
addition
any of it.
To doing the research, you claim that the research that you did, but you don't have any of those articles.
I didn't print all the articles out.
Okay. In addition to the research
The
that you did.
research you say you
Would you
did.
agree in this particular case that you did not diagnose Jameson with osteogenesis imperfecta?
He's difficult to say at this point because he's got a variant of unknown significance and we have to follow up with the lab in the future for test results and clinically also follow him up in the future.
Well, I asked you specifically last week, and you said, as of right now, you have not diagnosed him with osteogenesis imperfecta.
Yeah. We cannot,
Right.
well,
She
we
said
have to
that.
follow
That's
up
exactly
with-
what she said in a different way.
As we're
We
sitting
can't.
here today, on March 31st of 2025, you have not diagnosed him.
It's like some of the genetic conditions, you don't have the gene yet, but you kind of look at the family history and you think, this is odd. And you think, okay, there's a variant of unknown significance, we have to follow up. Black and white, you cannot diagnose yet, but suspicious.
Suspicious.
Yeah.
But
I
you have
found the
made
meme.
no diagnosis.
As yet, you clinically cannot.
Okay. You also told me you
All right,
had
hold
not
on.
diagnosed.
All right, Nick found the meme. Oh, I have to pull this off instead. God, I hate StreamYard lately.
It was so obvious. He got like one specific spot so dark that it covers up his scalp. It's
Oh,
like,
boy.
Did you use a mirror at all? Did you practice with one of those, those iron shaving with the magnets and then you could give the bald guy like a full Manchu? I was like, did you practice at all?
Oh, that's really good. It's really good. I love it. I love it. It's perfect.
Diagnosed him with Ehlers-Danlos Syndrome.
As of this point, I cannot because he's young. I have to follow him up as he grows up.
You didn't diagnose him with Cole-Carpenter syndrome.
No, not that I recall.
Leave the carpenters out of this, bitch.
In this particular situation, you've actually seen Jameson off and on for about 3 years.
Yes.
Okay. I'm not going to tender this. I just want to make sure we're talking about the same child. I'm going to show you.
It seems to be very hard for the prosecutor to understand that sometimes things take time. They can't just look at what other people say and say, abuse.
But that particular child has beautiful pearly white teeth.
You would have to look in close up, in real person, to look at the teeth. The picture is not very clear.
Okay. And when you looked at Jameson close up, you've never noted that he has poor dental teeth?
Dental teeth and all, you got to follow up as a child grows up, and the dental hygiene and all that kind of thing.
And in this particular case, Jameson has had no additional breaks while he's been in the care of his family?
Not to my knowledge.
He's had no unusual bruising when he's been in the care of his grandparents and his aunt and uncle?
Didn't they go through this with another
If
witness?
he had additional breaks or if he had additional bruising, that would have been important to you as his geneticist?
Yes.
And I asked you this specifically last week, and you told me that as you sit here today, you cannot say that Jameson was not physically abused.
What?
Physical abuse can occur in children with and without EDS.
So what you're saying is a child with EDS can be physically abused?
Yes.
A child with osteogenesis imperfecta
Of course.
can be physically abused?
Don't be a dumbass.
And after reviewing Jameson's
not
medical
pretending, Megan.
records, you cannot say he was not physically abused. You told me you were neutral. You can't
I'm
say it's
neutral.
physical
One way or
abuse.
the other, I
You
can't
can't
say.
say he has a genetic
Yes.
thing. You're just sitting here in the middle, neutral.
Yes.
So
Oh my God, I hate
if somebody
you.
said you were going to take the stand and say he had not been physically abused, that's false.
Difficult to say because one way or the other, you can't tell.
No further questions.
And if you can't tell, you can't prosecute. How is this not a win for the defense? It is having an expert say, yeah, we can't tell, means you can't fucking tell either.
Exactly.
Yep.
And that means you can't prosecute. You should never have brought this case. You dumb, stupid. I can't.
Cow.
Butt monkey.
I can't.
Butt
Cow.
monkey?
Cow. Yes, thank you. Cow. I
Thunder
almost used
cow.
the word I wasn't supposed to use. You dumb, stupid thunder cow. Yes.
Dr. Krishnamurthy.
Morning.
All right, Catherine.
Have
Finally,
you ever
someone with a
testified
brain.
in court before?
Yes, once before here.
So this is the second time you've testified in court. Okay. And you first saw Jameson in February of 2022, right?
Yes.
Okay. Did anyone from the state call you to talk about the report that you made?
That I made.
Yes.
I think I've spoken to Ms. Fox before.
And when did you speak to Ms. Fox?
I think I've spoken twice to her. The most recent was several days ago.
And do you remember when the first time was?
I think so. If I'm correct, some time back. Because the 3-4 different cases, you get confused at times. But definitely I spoke to her recently.
Do you remember if you spoke to anyone from the state before March 14th, 2022?
Carrie.
I can't recall that far back, yeah.
Okay.
Hello.
And so
Hola.
you have seen Jameson in your clinic 3 times, is that right?
Yes.
And each time was he was accompanied by his family members?
Yes.
And was there ever anybody from the Department of Family and Children's Services with them?
Not that I can recall.
So were you able to observe the dynamic among the family members and the interactions with Jameson?
Yes.
And did you notice anything about those interactions that was concerning or negative to you?
No.
And you are, as a pediatrician, you are a mandated reporter, right?
Yes, of course.
So if you see any evidence of child abuse, then you're required to report that to the Department of Human Services, right?
Yes, yes.
And so
I can tell the dog is feeling better because the mailman must be here and he is losing his ever-loving shit. Like he's going
Is my car
crazy
making
right
weird
now.
noises again?
I don't hear it yet. I don't hear any demonic weird ghost sounds.
No demon car today. Yes.
Excellent. So what are your thoughts on this witness, Carrie? And what's going on? Do you have thoughts you want to share?
I loved her. I loved her from the moment that we met her. and she was like, "You guys need someone famous to advocate for you guys." And I was like, cool. Can you pretend like you're famous and just speak on your expertise? That'd be great. And then, like I put in the chat earlier, she did decent for us. Wasn't the best. I mean, she's handling it well. However, it's like night and day when it comes to her testimony here versus the Hernandez case. Totally got to her and terrified her. She has privileges at the hospital that accused us, and I think they threatened to take those privileges away.
The frog demon has returned. The car is haunted, but that's okay. It's a little less. It's a little less demony than last time, but it's terrible. So the Hernandez case, was that after your case, Carrie?
I think.
Oh no, the demon got her. The frog demon got her. Carrie, scream if you can hear me.
No, it was after.
It was after. Okay. All right. Well, once Carrie gets released from the underworld, maybe we'll be able to speak to her again. Currently, it seems like we're having difficulties, but that's okay. We'll try again.
It does seem like I think she was not ready for kind of the condescension and what she was going to be asked. And I think if this is only her first or second time testifying, I could see how after the way Miss Fox treated her here, and then I'm sure she was much worse because there was a worse judge, she has just stopped doing this. It's absolutely, I mean, again, trying to throw out all that stuff, pointing out that she made a couple of mistakes in her report because of the dictation software. It's all intimidation, and she knows that her privileges, her hospital rights, could easily be taken away at state hospitals.
True. And that's what they do. They absolutely do that. Flux reminded me that we have been sitting here for a long time with no pee breaks. So we're going to take a short break. I still didn't make the pee song longer. It's only 3 minutes. Hopefully it will be enough time. If not, you guys can leave your mics on in case it ends and you can get to talking while I'm letting the dog out, because I think he might need a pee break as well. So we will be back in 3 minutes.
Streaming live, just killing the game. Sipping coffee like it's her middle name. A whiskey splash in her chai tea brew. But now she's squirming, doesn't know what to do. The chat is lit, emojis abound. But her legs are shaking, she feels the countdown. She's got a crowd watching her sway, but nature's call says she can't stay. BRB, gotta fly to the throne. Bathroom break, it's a live stream zone. Don't pause the stream, don't shut it down. She'll be back serving slay in this virtual town. She's a queen with a mug in hand, one espresso shot and she's taking a stand. But the coffee train has come full stop. It's an awkward dance, she's got a hop. The comments roll, where'd you go? Someone says, guess the drinks did flow. struggle's real, the time is near. Even YouTubers have bathrooms, dear. BRB, gotta fly to the throne. Bathroom break, it's a live stream zone. Don't pause the stream, don't shut it down. She'll be back serving sleigh in this virtual town. Gotta fly to the throne. Bathroom break, it's a live stream zone. Don't pause the stream, don't shut it down. She'll be back serving sleigh in this virtual town.
Ooh, Arizona
Muted,
tea.
Boomer. You're muted.
Whoops.
Can check that off your bingo cards.
Yes, I can. I got this
Oh,
watermelon.
Lord.
Arizona Cowboy Cocktail Watermelon.
Ooh.
But I don't know, what am I supposed to mix it with? So this is
It
not the
doesn't have
mixer.
booze in it already?
Vodka.
No. Vodka.
Mix it with
vodka.
vodka. Mm-hmm. Yeah. Ooh, or what's that pineapple? That pineapple-y stuff.
Malibu pineapple rum, I
That
think?
one. Yeah, Malibu. That would probably be good in it.
I don't have rum. I have rum at home, but I don't have that one at home.
Not Everclear. Don't add Everclear to anything if you want to remember. Flux, yesterday I realized that I passed on the Moism torch because my daughter was like, I like a boy. And she's like, but before you get worried, like I just like him more than like the other dumb boys. But she's like, he's in the marching band and he plays the trombone. So he's a tromboner. And I was like, I was laughing so hard I could barely function. Because then the part of me, like the
calling him that.
I know. The very small part of me that was like, you need to focus on the freeway and remind her that she can't probably say that. Also, I was like, does he know you call him that? And she's like, yeah, he thinks it's cool. He laughs all the time.
I bet they
And I was-
think it's funny.
To be fair, when I was in third grade, I felt like a genius because I realized that Nicholas could be easily changed to Dickolas. I apologize, Nicholas, from third grade. I hope middle school was better once I transferred out.
Oh.
Oh, goodness. Oh, good Lord. Tromboner. I love that.
Tromboner. Well, so you have one kid with the tromboner and one who wants to grow up to do hand jobs. And
I am, my cup runneth over with talented children. What can I say?
Oh, good
It was like the
Lord.
heavens parted, and she was anointed as the next Mo for Moisms when I pass on.
I love it. I love it. We definitely need to come out with like
A dictionary.
yeah, a YouTuber's dictionary or something where it's all of our combined fake words. Where it's just like,
Yes.
here, if you can't understand what we're saying, here's the manual.
Yeah, and then we need like an OG reference book, like a lore book. So I can just say like hand job, and then it will say, okay, here's the original video. This
a
has
good
been
idea.
a multi-level tale of woe and parenthood. And then you can just follow as it becomes infamous.
That's a great idea.
Such a fun.
We need a lore dictionary.
Yes.
Yeah.
Because
Totally.
I never know
Then
what
like
cult
someone
we're supposed
asked
to
me
be in.
today. Somebody asked me today in the chat, "What's the hat rack significance?" It was like, because Tug's always welcome to the hat rack. That was from a hilarious hate email he got from somebody who was threatening him and saying, "I'm going to put you in a hat rack," and they misspelled the word rack, R-A-K. And ever since then, he's been making memes that say, "Welcome to the hat rack." It's so good. I'm going to put you in a hat rack. God, it's so good. It's true. We need a lore dictionary. Someone needs to work on this. You know what? Maybe we should have lore trading cards. Remember?
Do you remember the Law Tube
Yes.
cards? Yeah.
They were so good. They were so good. I mean, God, Farmhand Tom did such a good job. But then like something happened and like we didn't get, I don't know what happened to them, but they were so good. And there's like the little
That is a good card.
I know. And then there's like a story on the back all about why it happened and what it was about. God, I love these.
We need to do a lay tuber card deck. We're loosely affiliated, somewhat adjacent to LawTube.
I don't know about the lay tube. I think we may have to rethink that.
It's a single entendre. It's my favorite kind of entendre. Well, because everyone else is a law tuber, so I'm just a lay person tubing. So,
oh, Carrie's back. Okay,
Yeah.
How are you?
Any frogs still?
Any frog demons?
Frogs have been slain.
Muted Boomer.
No,
I
it's
already.
just delayed. It's just delayed.
Yeah,
it's delayed. I can't hear her.
Oh, I could hear. There was
You
no
did?
frogs, just delayed.
Try again, Carrie. Look at her.
This is me trying again.
Oh, there we
Okay.
go.
There
Now
we
I
go.
heard it. Okay. All right. We're all good. We're all good.
No. I did, but I did do the boomer thing. I started talking while muted.
Perfect. So we
Yeah,
can
we had
check
muted
that off the
Boomer.
card. All right. Excellent.
I need objection to get bingo
Yeah, there's
or
been objections
Spider-Man
today.
meme.
There's been no objections today, which is weird.
Just wait.
well, someone in the chat put the Spider-Man meme as motorcycle dirt track or osteogenesis imperfecta. Like that's how Brady got.
Oh yeah.
You know,
Carrie, tell us about the drag track, the drag strip. Oh no, she disappeared. Right. Oh, Carrie, come back. She got pulled into the nether again.
Carrie, come back.
Carrie,
kind
come
of fool
back.
could see I was wrong.
All right. Well, when it works out, we'll stop the stream and we'll talk to her again. But poor Carrie, it's not going well today.
If you had seen any evidence of abuse being perpetrated on Jameson Timms, would you have reported it?
Yes.
As you are required to do?
Yes.
But you didn't see any of that evidence. And in your practice, have you treated children who were abused and subjected to inflicted trauma?
Yes.
So you have seen that before?
Yes.
And you have reported that before?
Yes.
But you did not do that in the case of Jameson Timms?
No, the family interaction was normal.
And did you see anything in Jameson's test results that suggested other kinds of injuries, like head injuries or hemorrhaging or other suspicious factors?
No.
And you said that throughout the time that you have treated Jameson, you did not see any additional broken bones or fractures or anything like that, right?
Yes.
All right, so let's talk a little bit about your visits with Jameson.
Okay.
So your first visit.
Okay,
with
Carrie, I think it's working. I think we're back.
I swear on all the things.
On
All right,
all the things.
The chat, you sound good. The chat is concerned. They're like, Carrie looks upset. Is Carrie okay?
No. Just work. I just want my technology to work. Just work. Do it. Do your
I
job
feel
like the
that.
other people that have needed to do their job in this freaking investigation.
True.
Okay.
We need our technology to work. I was feeling that last night when my spectrum went down and then the power went down right in the beginning of my stream. It was brutal. So I feel you. Okay, the question I had for you was about the drag strip. Please tell us about the drag strip.
Oh, it's just so loud and deafening. So deafening that there's only 2 family members who experienced hearing loss, which is going to be Lee, which is my father-in-law, and his father, who built the drag strip, which, guess what? Those are the only people who carry the flippin' gene mutation. How can we... Am I lost again? Did I go away?
No.
Okay.
No, we hear you.
No, we got
You're
you.
good.
Okay. So none of the women, like the great grandmother, Brady's mother, no hearing loss. They've lived there. Brady lived there his entire childhood. No hearing loss. Like it infuriated Brady. Like as soon as she.
Oh no.
Oh no.
Poor Carrie. She's going to have an absolute crash out. Carrie, it's okay.
Carrie, we've all been there. Look, cursing behind the streams, calling your technology everything but its Christian name is totally okay.
It's
Tears
totally normal.
Angry tears are also normal.
It's totally normal.
It's also perfectly normal that everything starts working once you're in a big tirade about how fucked up everything is.
Yeah.
Yeah.
Exactly. All right. Well, we'll leave her there. If she comes back, we'll start over again.
Jameson in February of 2022. What do you recall about his physical condition at the time?
I recall the light blue sclera.
Okay.
The soft doughy skin.
And the sclera, that's the part of your
white,
eye that's
the white
usually
of the eyes.
So that it's usually supposed to be white.
Most of the times.
But when you saw Jameson in February, it was light blue?
Yes.
And how about when you visited with Jameson in 2020, in May and August of 2024? Was that still the case for him or had it changed?
I think still the case.
Okay. So even when you were seeing him as a 3-year-old, he still showed the light blue sclera?
Yes.
And you mentioned doughy skin. Can you describe that for the jury? Why that would be important, what you're looking for, and what Jameson's skin looked like to you?
Soft. Very nice to the touch. It's not firm.
Okay. And would you expect it to be firm when you are doing an exam?
Generally.
So that was an unusual finding?
Yeah, when I see soft doughy skin, I think of 2 things. One, I think of either connective tissue disorder. I think of low muscle tone.
And did you do any additional testing or observation to see if low muscle tone was an issue with Jameson?
No, his milestones were normal at that point.
Okay.
I mean, he was doing all the things a 4-month-old should do.
So other than the light blue sclera and the soft doughy skin, did you observe anything else about Jameson's physical condition that was of concern to you?
I don't know if I can look at my chart.
Absolutely, you can
I
refer
can't
to your notes.
yeah.
I know this
I can't recall.
was 3 years ago.
It was some time ago.
Her eyesight can't be good.
No. And she's
Yeah,
also
no.
very small. She's also very small.
I saw his
Yeah.
It was light blue. I saw his hips were stable at the first visit. Everything else looked okay.
Okay. Did he seem to be in any great pain or distress when you observed him? Did he seem, did you notice any unusual bruising or injuries or anything else
No,
on any of the times that you visited with Jameson?
No.
When you first visited with Jameson, had you already received the genetic testing results from Children's Hospital that showed the genetic variant on call 1A2
1A2, yes.
and SP7?
Yes, the INVITE test results, yes.
And then when you visited with Jameson in May of 2024, did you observe anything about any skin rashes or skin modeling?
I think so, yes. I'm trying to recall, I think yes.
I used to do that in grade school. In fact, teachers used to yell at me because I would be down writing near my paper like this.
Yes.
And they would always yell at me and I'd be like, leave me alone. This is how I'm comfortable. Like, leave me alone. She does need a phone book though. It's just so far down in the chair.
Yes, he had a rash, especially when he strains. And in the history, I got the history that he has popping and cracking of joints. And grandmother reported that he says, ow, when the joints pop. That was the history I got at the second visit. And he has soft, dewy skin again with the blue sclera.
And did you notice or learn anything about any digestive issues?
His constipation and abdominal pain. And he did complain of abnormal bruising at that visit.
Okay.
I mean, the family gave me the history.
And was this still the grandmother giving you the history, or was anyone else giving you that information?
I think history is mostly from the grandmother and grandfather.
Okay. Right. And then, so the May visit was when you ordered the DEXA scan that was completed in July of 2024,
Yes,
right?
Yes.
And a DEXA scan, let me see if I can get this right, dual emission X-ray absorbometry. Okay, and so that's kind of like an extra strong X-ray, is that a?
No, it looks at how strong your bones are generally.
Okay, so, but it does that with regular X-ray technology, just more of it?
I'm not the radiologist to say how they do it, yeah.
Well, but I guess, so when you get the result from the DEXA scan, what are you measuring it against to see if it's normal or not?
Yeah, and so that's the thing. I wanted to get a baseline to see if I could get any information out of it, but not much information. And it's my understanding that I would have to repeat it in the future so that I can compare it to other children who are of the same age, who are normal, and then that would give me a better result in the future, whether yes or no, it means something.
Okay. And did the assessment on Jameson's DEXA scan come back below the mean, even though it was within normal range?
I think so, yes. But again, I'm not the radiologist to say, but
Right.
I've done research on that, and what was suggested to me was that there was not enough information, and it is good to repeat the test in the future.
And in the time that you have been working as a pediatric geneticist, have you seen gene variants change classification from unknown significance to likely pathogenic or likely benign?
Yes, yes,
Okay, so that is something that you have seen in the course of your practice and research?
yes.
And is that something that you have seen with the genetic variation that Jameson has on COL1A2 or SP7?
Maybe not the same specific gene change. I would have to look at all the records that I have so far for patients, but generally, I've seen the labs change their report one way or the other.
Okay. But have the labs changed their report on these particular variants in Jameson's case?
They haven't changed it yet. I mean, for this case itself or for the gene as such?
For the gene itself and for Jameson's individual case?
In Jameson's individual case, they haven't changed the thing, but for the gene as such or other genes associated with connective tissue disorders, I've had patients where the results have changed.
Okay. And now you, I believe the diagnosis on the, on your original report, the genetics report that you made, was on February 15th, 2022, systemic involvement of connective tissue unspecified.
Yeah.
Okay, sticky widget. You, sir, what is it that you are doing? Sticky has made a trading card for his lore. Brains and Blades, Intelligence 7, Agility 9, Charisma 6, Short Swords, Coin Cyclone, with Bill Nye, I see here. Next.
I love that.
Well, wait, you forgot to put court contempt on here. You forgot to put chat contempt. Oh my God. This is so funny. This is what we need, though. We need lore cards. We need lore cards.
do.
This needs to happen.
So that was your initial
Clinical-
diagnosis based
clinical
on
Yes.
based on the exam and the genetic results.
Yeah.
And you mentioned earlier that connective tissue is kind of like the scaffolding that holds up everything in our body.
Yes.
So if someone has an issue, even a small issue, with the way that their connective tissue is being put together, would you expect that to affect many different parts of the body, just one part of the body? What would you expect based on your experience, training, and research?
Okay, it depends, basically. If this is the gene, is that what are the other factors that are affecting the strength of the bone? Could there be associated copper deficiency? That's also involved in making the bone. What about vitamin C? That's also involved in making the bone. What about other things like manganese? And so there are other cofactors that we have to think about when we think of the strength of the bone or the making of the bone.
Okay. So you mentioned that vitamin C is one
Yes.
of those
Yes.
factors. Is
Yes.
vitamin C involved in collagen production?
Yes.
Okay. And then you mentioned manganese as well. What is the impact of manganese?
I think that one of the cofactors, just like copper and vitamin D, is also important, because if you have vitamin D deficiency, that can also increase the risk for fractures if you have some other cofactor that is, it's not just one thing, it's other things also that is involved.
Okay. Now, have you ever dealt with any patients that have been diagnosed with birth-related fractures?
Yes.
Okay. So is that something that you've seen before in your practice?
Yes.
And have you observed anything about, I guess, cofactors might be the word for when you have observed patients who have birth-related fractures?
Like, I've had several patients where when they were born, the birth was a little difficult, so the arm was fractured. Sometimes the clavicle can be fractured. Things like that.
Okay. And how about any medications that the mother may be taking during pregnancy, specifically anti-nausea or blood pressure medication? Have you done any work or noticed any?
I would have to do research on that.
Okay. And you were only treating Jameson Timms as your patient,
Yes.
right? Brady Timms and Carrie Timms were not your patients. Did you have occasion to make any observations about the physical condition of my client, Carrie Timms, while you were treating her son?
Yes, she showed me her arms, which are hyperflexible.
Okay. But did you conduct a formal Beighton scale test on her?
I was seeing only the child.
But from what you observed, she did have hypermobility and more flexibility than you would expect from someone of her build and age?
Her elbows were definitely hyperflexible.
Didn't that other one say she didn't have the elbows?
No.
And
yeah, she
did you have access to any vitamin D testing that was conducted on Jameson at birth or during the pregnancy for Carrie Timms?
Not that I can recall.
And I think, you know, in your discussion with Ms. Fox and Mr. Hood, we heard a lot of it depends and we don't know yet. Is that fair to say that those have been your findings with regard to some of this genetic testing?
Yes.
And so you, like you said, you cannot say Jameson Timms has osteogenesis imperfecta or any other condition, right?
Yes.
But you can say Jameson Timms has genetic variants on the genes responsible for creating and strengthening connective tissue, right?
Yes.
Okay. And over the 3 years that
go
you have
ahead and
seen,
check off irrefutable proof on the bingo card, because that's pretty irrefutable proof. He has the markers that affect collagen. Yes. Yes. Irrefutable proof that this state are a bunch of paste eaters.
Okay, now I need mic drop judge to get a bingo.
Okay. And I need, what do I need? I am still far away from a bingo. God darn it. I just can't win today. If I get a sustained, I have bingo on one card. But we still haven't had any objections today. How weird.
and
And
treated
no sidebars.
No sidebars, no objections. Huh.
Jameson Timms, have you had any concerns that his family was subjecting him to abuse or anyone in his family?
No.
Did you get the impression that this was a family that would tolerate abuse or make excuses for it in some way?
No.
Because you have had families like that,
Yep.
but not this family.
No.
Oh boy.
Thank you very much, Dr. Krishnamurthy. We appreciate your time.
Damn, mic drop witness.
Mic drop.
Yeah, mic drop witness,
Holy
definitely. Yeah.
It especially helped that was one of the, she was never very forceful, but those she did make direct eye contact and she spoke more forward. I think that's probably why she's very timid when she speaks. I wish she would have been a little bit more confident because she has her things, but she was probably really nervous. She's not like us.
She
who
also just
wanna
seems to
all-
be, she doesn't seem to be the kind of person who really shows a ton of emotion, though. I mean, she's just pretty straightforward and like soft spoken. So it's probably out of her nature to fight back against that kind of attack. She's just not rude,
Yeah.
you know, unlike us bitches who would be in your face.
Yeah, because we would have been like, I'm sorry, I'm adjusting my glasses.
I'm sorry,
I've
what
got
did
a
you say to me?
itch.
You
I'm
want to tangle?
verklempt.
You want to go?
I'd be like,
Yeah.
Judge, hand me a Werther's. I'm gonna need it after I say what I say. Before you,
Rob Pate, thanks for the 5, says, shucks, sex scandal face bingo box has been useless since we entered the defense part. Well, that's why I took it off of the defense card. It isn't there. And M169, thanks for the 10, says, my husband is lucky he's a boomer, born with 2 broken legs and knee problems all his life. One knee totally reconstructed by high school and a partial reconstruction a few years later on the other. That is insane. That is horrific pain. Your poor husband. Give him an extra treat or something today. Give him something nice today. Tell him it's from us. I don't know. I won't tell you what to give him. Let's give him something.
Give him a circle squish.
He's like, are you sure you haven't taken your happy gummy yet? And he's like, go take that. You'll be happier.
You'll be happier. Maybe not. Thanks for the 5. The prosecutor can't understand normal thinking. Yes, the C word has already been dropped. Thank you for that, though. Thank you for the reminder. Let's see. We only have a few more minutes here. Let's see what happens. If anything else happens.
Thank you, Ms. Bernard. Mr. Hood, any additional questions of your witness?
No additional questions.
Ms. Fox, any additional questions of this witness?
Oh, gee, she's got to have the last word. She has to have the last word.
Information you got from the family history is actually self-reported, wasn't it?
Oh,
yes.
How else are you going to get it?
Hearing loss. Yes. If they don't explain,
how else are you going to get that history?
She's going back to the dirt bike,
she's going back to the racetrack.
They live near the drag strip. There's factors that you might want to know whether it's environmental
summoned
or genetic.
Ghost, you are so bad a prosecutor.
When they say, I've had a normal, uncomplicated pregnancy, but you didn't physically look at the birth records.
No.
You're taking at the word.
Yes.
When the mom turns around and does that, says, well, I've got hyperflexibility.
What's she doing with her hands?
She's showing the hyperflexibility.
Whether than the fact she can do a trick with her elbows.
Is that hyperflexibility?
A trick with her elbow.
A trick with her. And by the way, the elbow thing is out this way. It's not what she does in the back. That's not the elbow thing. The elbow is, do the elbows flex up that way? See, mine don't.
I can do that.
Well, Carrie can do it way higher. Mo has something to say.
Screw this chick sideways with a cactus. You guys wonder why I have all the cactuses? Because I can't really have a bag of Richards up there, even if they're fuzzy. So I can't tell people to eat a bag of fuzzy Richards and then produce it because you guys would want to see them. And thus far, googly eyes have not made them unbannable. So
googly eyes.
So I had to go with the cactuses. But my fight to have googly eyes fuzzy Richards in a bag and not be demonetized will continue.
She hyperextended her elbows.
Yeah,
Yeah,
just like I
see?
just did.
No.
Doesn't mean you have a syndrome. It just
No, she hyperextend her like this. Like this. They go the other way. Not like what she just did with the back. No, she's trying to
means
tell
you
you.
can
God, shut up.
put your elbows together behind your back.
Oh, check off, shut up.
No further questions, Your Honor.
Ms. Bernard?
Have any of these additional questions changed your assessment about the patient Jameson Timms?
No.
And
Catherine's making sure she doesn't
is
get the
there
last word.
anything concerning about Jameson Timms to you as a mandated reporter that you haven't told us about already?
No.
Thank you very much, Dr. Krishnamurthy.
Damn.
Good job for you. Good job, Catherine, for not letting that bitch have the last word. No, you will not. Not today, Satan. You shall not pass. I like that.
Yeah. Oh my God.
She's the bitch rod instead of the Balrog.
Good. the bitch
Love
rod.
it. Oh my
And
God.
Megan,
I have a lot of
make
bitch
Megan
frog.
as Gandalf and, make her as the Balrog. And Megan's like, you shall not. Look, I just need this in
Shall
my
not
life.
pass. Okay, so we have quite a few. We have quite a few bingo squares to add for Monday. State makes us day drink or do THC. Drag strip is going on there. Cat kisses, because that was the cutest thing we ever saw. Panel fails in cheating. What is this? Oh, stoned Archie Ruckus memes. So make sure you work on those over the weekend.
Yes.
Yeah, we still haven't seen prosecutor in Cone of Shame.
Yes.
Oh yeah,
Oh, yeah, we
prosecutor and
need
cone of
that.
shame. We haven't seen that yet. Well, let me check Twitter real quick. Maybe I'm falling behind on the memes. Let's see. Sometimes you people send it to me.
Yeah, but Doug was good. He was like, I do not want the cone of shame. I am a good Doug. And she's like the little dachshund, robo butt dog. The mean
All right.
one.
We do not have anything else on the Twitters to view. Okay. So we will be back with day 20 on Monday at the same time, probably 10 o'clock. 10 o'clock works. I feel like 9 is too early. I feel like rushed to get here by 9. And I feel like that gives us a good 2 hours. We've been going 2 hours and 44 minutes here, so it's fine before I have to take the other one to school.
And
so
I'm
what is
on Mornings with Mo with all the crazy going on?
perfect. So it gives you time to wrap that up and come on over. So tell me, each of you, we'll start with Mo and we'll go around. What's coming up for you that people should be aware of, and where do they find you? And mods, please do put my panelists' channels in the chat.
Let's see. Tomorrow I will be on with Shizzy Wisnut. We do a weekly wrap up where we just find the most absurd stories, usually not safe for work. I'm just throwing that out there. Stories. And then we've started this new thing where we do News House Rocks. So think Schoolhouse Rocks, but inappropriate headlines turned into songs that you again should have earbuds in for. But it's super fun. We start at 8 Central and we just try to figure out who's going to snort laugh first.
Perfect. That sounds really good. And we know, Nick, you've got you've got your cult stream coming up tomorrow at 4.
Yes.
What else do you want people to know about?
Oh, I'm in the works of a video because I got "This is your one and only warning" message. So of course I'm going to shame the ever living fuck out of that person.
Nice. Was it a cease and desist?
No, it was just one of these message via YouTube. And it's
great.
the worst English ever.
Perfect.
And,
America, dumb and proud.
Dumb and proud.
We are not smart.
Oh. Hold on, where is it? Community mentions. Let me see.
It's always the community mentions.
Yeah.
It's always the
Hey, stupid. Yo, I do know if yo's been following the news shit, but they did solve this shit, homie. On God, they did.
What?
Yeah.
I like the homie thrown in there, though. Homie is good.
Because when you see me, you instinctly say, "Oh, homie."
Hey, homie.
Yeah.
What's up, homie?
What's up, homie? I'm gonna call you homie from now on. That's funny.
Yeah, so I'm going to do a video when I read this and everything. Now, my members already know about this and everything, but I thought, I mean, seriously, my one and only warning. Thank you for a heads up. I will not return the favor. Stupid.
Okay, but did we even ascertain what they were talking about and what you were warned against? Because I'm a little confused.
Yeah.
I think it is the Delphi case.
Oh, that tracks because the only people who think
that.
Yep, and the only people who think that guy did it are total dumbasses. So that tracks. That tracks.
Yeah.
What about you, Flux? What do you got going on? What's coming up for you?
Just mostly my streams are a little sporadic right now because it's finals week this week and then I start my new quarter next week.
Right.
But I'm just we have a new download or last week the new update for Project Zomboid dropped. So I've started a new world where we're living a nomad life. So we're just running around Knox County in an RV in the zombie apocalypse in a Winnebago.
Sounds fun. We need to do either trucking or Red Dead 2 stream soon. We really do. We need to talk to Connor about that. All right, everybody, I'm out of here. Come back on Monday. And those of you in the chat who asked, how's Gadfly? How's he doing? He's doing great. And I texted him to tell him that you miss him. And guess what? He said he would drop in on Monday to hang out with us for a little while. So we'll get to see Gadfly for a while. All right. See you guys later. Have a fantastic weekend.